Okay, maupo na po sila para makapagsimula tayo. Okay, itabi na yung mga laruan. Please. Okay, so I hope everyone had a good weekend. Yes, no? I know, right? It rained a lot, especially Saturday. Oh my God, it ruined our plan. It wasn't meant to be. Okay, there is always, we always say, another time, right? Okay, hopefully. All right, so another, a new topic today, motivational interviewing. Okay, sino dito ang nag-attend na ng, who attended training on MI? Raise your hands. MI training. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay, how many times? Yung iba na more than once. Taas ang kamay. More than once. Okay, so basic MI, ganun ba yan? Okay. Sino, saan yun na, how did you get the training? Ah, okay. Interpret. Okay, so kasama dun sa module yun ang interpret. Okay, so this might sound repetitious, but let's say, okay? So I expect from you more. All right, so MI or motivational interviewing. All right, so who are the two people? Oh, wag mo na i-move. Wala ka ba ano? Nasaan na yung... Okay, so sino yung dalawang tao na nag-develop ng MI? Let's see. Those who trained. Yung mga nag-training. Hindi nyo alam sino nag-develop ng MI? Nag-attend kayo ng training? You never asked? Di ba? Kailangan maalala nyo yun. Yun nga, hindi yung makalimutan dapat. Sino ang nag-develop ng MI? So, there are two guys. Ayaw, King. Oh. Okay. Ayaw talaga. Ayan. Oo nga pala. Okay, two guys, right? William Miller and Stephen Rolnick. Okay. William Miller is an American psychologist. Rolnick is a British physician. Okay? And they actually came up, their book is called Motivational Interviewing. Preparing people to change. Oh, wow. Addictive behavior. But actually, it wasn't specific to addiction. Preparing people to change. That's the original title, yung first edition yan, no? Ng libro. Okay, so you can still buy those, the original book by Miller and Rolnick. They have an interesting story on how the model was developed. So, William Miller, like I told you, is an American psychologist. So he was just like all of us, in counseling, you try to develop a technique on how to work with your clients. And early on in our job, we struggle with motivating clients, correct? To change. That's universal. That's even in our program, we struggle with motivating them, right? In the program. So Miller encountered that. So he tried to find a way to overcome motivation, right, in working with his clients, right? Now, Rolnick, who is a physician, a British physician, also struggled with motivation, but not helping clients in counseling, right? Helping clients to get motivated to follow medical advice, right? So, just like many of us, sabi na nga ng doktor, ako, yung sugar mo tumataas, right? But we cannot help it. We continue to eat food that we are not supposed to eat, right? So, we are addicted to sugar. We are addicted to carbs. You might find it funny, but actually, there is such thing as addiction to carbohydrates. And I'll tell you how you find out. Try not eating rice for a few days. Right? Magkaka-withdrawal ka. Totoo yun. Magkaka-withdrawal ka. And then mapag, naku, gutom. Kahit na kumain ka na, gutom pa rin ako. Busog ka na, gutom pa rin ako. Because actually the brain is craving for, the bottom line is sugar. You know, carbs is broken down into glycogen. That's the final product, correct? Glucose, sugar, right? Okay. You understand? So, there is such thing as addiction to carbohydrates. That's very real. If you stop drinking Coke, Joanne, right? You know what happens, right? Okay. So both of them struggled with motivating clients to follow medical advice. So Rolnick also was trying to develop a way to actually motivate his patients to follow medical advice. And it is always a struggle, right? So one day, I think they went to a conference. They went to a conference and they started talking about, and those two guys are like I told you, different disciplines, right? But they are dealing with the same thing, motivating clients. So they got into talking, and then they found out that they were actually trying to develop a way to motivate clients. And then they started collaborating. So the book that they produced was actually motivational interviewing. Okay? Why interviewing, not motivational counseling? Because in Rolnick's part, he's not really counseling clients. He's trying to always find out, did you follow what I told you, right? So it's not really, it's not counseling. He's trying to check if his clients are actually following his recommendation. So I believe I think they agree on interviewing rather than counseling. All right. So, which is kind of odd. Right? You would imagine it should be counseling, motivational counseling, but it's interviewing. We actually interview clients. It's a form of interview. It's not a traditional counseling, although there are a lot of elements in trying to develop rapport, right, with clients. You use a lot of counseling techniques, and we'll talk about that later on. What are those techniques? To develop rapport with your client. It's the same thing like I was telling you earlier. Relationship, right? Building a relationship is also building a rapport, right? Because if you develop a positive relationship with your clients, you have very high level of rapport with your client, correct? So it's the same thing. It's relationship, building relationship with client, okay? All right, so that's a story of Miller and Rolnick. Okay, two different people from different places studying the same thing. It's funny, there's so many discoveries in the field of in science and medicine. That same story. I told you the story of how mRNA technology, vaccine technology, was developed, right? Two scientists, Carrico and Weissman. They're two different people. And then they just by chance they met. In their case, they were just talking while making copies in the Xerox machine, and they started talking about what it is that they were doing. And I realized that they were trying to achieve the same thing, but they were separately doing different things. Okay, so they collaborated and they came up with the mRNA technology. So there's so many stories like that. Separately, people, or sometimes people are from different parts of the world, and they're doing the same thing. And then somehow fate, arrange that they meet, and then they come up with amazing technology. All right. So it's the same story with these two guys. So what are the objectives of MI? Examine what motivates people to change. Hopefully, in this training, you know, you realize those objectives. Examine what motivates people to change. Okay? And learn about the spirit, principles, and core methods of motivation interviewing. Spirit, principles, and core methods. Those three. Okay, those are the three important things to learn in MI. The rest are just enhancements. You understand? Enhancements. But if you can learn those three, right, you have the foundation of MI. And what makes it, how you become better with this is you practice. That's it, right? So hopefully, it's very ambitious for me to actually say in 2 days you'll be able to be a good MI interview. It's a fantasy. Okay? But is it possible that you can build on it? Of course you can build on it. Okay? So that's the whole idea of becoming good with MI is practice. Okay, you can keep attending seminars, training, workshop. That's not gonna make you a good counselor who can actually use MI. Practice, practice, practice. A lot of the spirit of MI, it's more like an attitude thing. How you work with people. That's the most important thing, right? Many of us in TC, our style is very directive, correct? We tell clients what to do all the time. That's what TC is. It's very directive. And Emma is saying, less directive. Is it directive? Actually, it is. But it is not a different kind of directive. Okay? It's more guiding the clients than telling clients all the time. It doesn't tell clients what to do. It helps clients, guide the clients, for the clients to do things that he's supposed to do. Right? Okay. So that's what's important. Learn the principles, and then practice the core methods and become good at it. Okay? And then look at your perspective, your attitude, or how you work with clients. Okay? Practice incorporating MI skills into your work. Okay? And then we'll talk about how MI, in spite of the fact that they seems to be different approaches, how can we make it? How can we reconcile the MI with the TC approach? How can we marry the two without the two fighting all the time? Okay? So that's again, that's a challenge. People ask me, hey Doc, pwede bang i-apply yung MI sa TC? That's the common question they ask me. Because they know it sounds like they're very different. But we'll find ways where we could actually be more motivational rather than directive. Because I think there are rooms, there are areas where you don't have to be directive with clients. There are times, depending on the situation, right, that you have to be directive with clients. Okay? Okay, so what is MI? A client-centered, goal-oriented method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. Okay, the two big words there is intrinsic motivation and resolving ambivalence, or the word ambivalence. Okay, so who can tell me what is intrinsic motivation? Anyone? Okay, so there are two kinds of motivations, correct? What's the other one, Ivan? I know you know. Okay, extrinsic motivation. So what is intrinsic, Ivan? Yes, intrinsic.
Well, maybe I can better answer that by distinguishing the two. Extrinsic motivation is a motivation that pushes you to do something. External motivation that pushes you to do something. Let's say someone told you to do so, otherwise he or she will punish you. That's the extrinsic motivation. Intrinsic motivation is a motivation like doing something because you love doing it, because you are very convinced that you really have to do it. So that's intrinsic.
Very good. Very good. That's what it is. You hit it right there. So extrinsic is an external force or factor that actually compel a person to do something, right? And in this case, to give up drugs. In our case, right? To change. Part of the change to give up drugs. Okay, so what are some of the external forces for our clients forcing them to change? Police, what else? Exactly. The court, legal pressure, right? External, from the outside. Whereas internal is coming from inside a person. Okay, inside a person, it's coming from you. You are convinced, you are motivated. Okay, internally to do something or to change your behavior or give up drugs. Is it clear? Okay, in this case, we are talking about intrinsic motivation, and okay, because external or extrinsic motivation, is it permanent? Permanent? Very often it's not, because once that pressure is taken away, there is no more desire, right? Intrinsic is you owned it. It's coming from you, so it is more long lasting, right? Okay. So the goal is to help people develop intrinsic motivation. Okay? Which is challenging. Very challenging. So how do you do that? How do you help a person develop internal motivation to do things that they needed to do? In this case, to give up using drugs or to change their behavior. Okay? Challenging, correct? And that's the goal of MI. Right? Now, it says resolving ambivalence. What is ambivalence? Is that a singing group? The ambivalence? Okay. What is it, Gilbert?
When you have contradicting feelings or mixed feelings about something you want to do.
Conflicting, right? Conflicting. You want this, however, if I do this, there are these consequences. No? Do we experience ambivalence in life? All the time. All the time. As simple as what to wear. The ladies probably go through that every morning. You have two sets of clothes hanging in the hanger, right? Okay, you look at it and say, Monday, right? It looks like this one. Before going to bed, you already said this one, right? Guess what happens when you wake up in the morning? You have second thoughts, correct? Second thoughts now. Or Monday, pero mukhang maganda ata yung isa. Okay? So now you don't know what to do. So you eat your breakfast and you're still not decided what to wear, right? You're still actually debating about it. Not as simple as choosing what to wear, right? We go through what we call ambivalence. That's a small thing. But there are a lot of situations in life where we actually go through extreme level of ambivalence, right? For example, uh, 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 you're a woman and you have different suitors, right? And then, uh, you're thinking, oh, this guy or that guy, and your family saying that guy, your heart is saying the other guy. You understand? Yeah, right. So even that is a major one, because once you made that choice, you're doomed. Now, once you make that choice, you're stuck, right? That is a commitment, a long-term commitment, right? Okay, so we go. major, right? Another one. You want to buy a car. We buying a car, right? Or even a motorcycle. You go through brands, right? Oh, this brand, and then you study. Okay, these are the good things about this brand, this car, right? And then you look at that. Oh, mukhang maganda ata to. And then you go through that, right? Sometimes even more than one or more than two. You go through that, right? And you cannot make up your mind which one to take. Okay, price. You look at the price, right? Oh, mukhang mura to, pero mas maganda ata yun. You know, it's just like a few thousand pesos, you know, the difference. You go through that, right? So you don't like make a, you know, you go to a dealer and just, oh, I like this car, and you buy the car. Who does that? Well, if you're a billionaire, you can do that because you can always change it if you don't like it, right? But we are not billionaires. You know, we put a lot, we made a lot of, I mean, hard work, right? To make those money. So everyone, I mean, it's important to us that we get the best bang out of our money, right? That's where the ambivalence is. Okay, what if you make a mistake? Boy, you know, you're stuck with your car for several years, right? All right. The interesting thing, right? I'm gonna tell you a secret about ambivalence. It's actually dissonance, right? Cognitive dissonance. Once you resolve that ambivalence, you're committed to it. Because you know what? It creates a lot of anxiety when you are not decided, correct? Sometimes, you know, you lose sleep over it, you know, you chew on it, and you cannot seem to make a decision, right? So, but once you make a decision, you're committed to it. Same thing, you know, you choose your guy, right? Once you choose your guy, you're convinced this is the right choice, right? You're not gonna tell your friends like, oh my God, the guy I chose sucks. You're not gonna go tell your friends the guy I married sucks. I made a mistake. Huh? Hindi yan television na may warranty, okay? That you can go back to the store and complain, this doesn't work. Can I just return it to you? You cannot do that with your guy or your girl. The same thing with the guys. Same thing with the guys. All of us, right? So you're committed. So what happens? Oh, I have a wonderful husband. Not really. No, you don't do that. Why you cannot look at the bad side of the guy once you choose the guy? Because it's gonna create a lot of anxiety in you, right? You avoid looking at that. You just kind of, di bali na. Hindi naman malaking bagay yun eh. Pwede na lang pagpasensyahan yan. Okay. It's funny, but we go through that, right? So we're committed, you know, and then we find the good things about that. Same thing, you buy a car, right? You bought a car. You're driving, right? And the stop sign, your friend will happen to be there. And your friend say, hey, Perry, what a wonderful car. You know, he's how is it working for you? Do you like the car? Are you going to say to your friend, no, I hate this car. You just bought the car. You're not going to tell your friend, this car is terrible. Because it's going to create more anxiety in you. They say, oh, I wasted my money, blah, 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 right? That's the nature of our mind. Once we settle, we don't go back there and stress ourselves out. Okay, all of us do that, right? That's a wonderful thing. And then if we could apply that in counseling, you know, once you help the person go through that dissonance, the ambivalence, and then, you know, help him make a decision, not you making that decision. He has to make the decision. He is committed to that. So hopefully, the idea is to help him make the right choice. That's how we guide him. We guide him to make the right choice, but we don't tell him, this is better for you. That's not MI. That's not MI. He has to make that choice. And hopefully, you know, you can guide a person to make the right choice. Once that person make that choice and say, okay, this is what I'm going to do, that person is very likely to be committed. Once that dissonance is, you know, he makes a decision, the dissonance comes down, and then he's committed to that. He cannot go back to the other choice. All right? And that's the nature of our mind. We want like homeostasis, a state of equilibrium, because if it's the imbalance, it creates stress in our mind, in our body, and in our emotions. All right, so that's, I'm telling you, the way this works. Okay, and then we're gonna see how, the different techniques is applied using those principles. You got it, guys. It's not really deep. You understood what I'm saying. Now, how do we apply that in our counseling, in our work, in helping our clients, right? Okay, so that's the whole idea of the training. Hopefully, we develop those skills. Helping people talk themselves into changing. All we do is really talk. The use of language in achieving, our goal, and helping our clients achieve their goals. Just talk. Okay? This is dedicated to all who are weary of trying to educate, advise, entice, convince, coax, cajole, persuade, sweet talk, smooth talk, guilt trip, bribe, manipulate, or otherwise get people to change. We try all of those. We try all of those with our kids too. Right? Yeah. No different than, the way we work with our clients. Sometimes we even plead. Please. All right. So, this is dedicated to all of us who try to help people change. What does it mean to help someone to change? What does it mean to help people change? Is all help helpful? Is all helpful? Okay, sometimes we say we're helping, but in reality, we are not helping the person. That's why there is such a term as enabling behavior. Our parents do that, right? Our parents. Okay, so we have siblings, right? Okay, and we have siblings who is not doing well, right? And keeps convincing your mom, if you just give me another chance, I will do this, blah, blah, blah. Yeah, right? And your mom, okay, so finally, continue to actually believe your brother, right? Because your mom says, one of these days he will realize, one of these days. It's been 5 years, mom, uh, why you keep enabling my brother, okay? All family has, not all, but most families go through this, correct? Yeah, in one form or another. So that help that we say sometimes is helping is not helpful. Okay, so we've got to realize when the help is not working. Okay, and we should be willing to take a look at that and try another way of doing it. So why am I? Evidence-based practice. Everybody understand what it means to be evidence? What's an evidence-based practice? Anyone? Philip, what's evidence practice? Evidence-based.
Yes, Doc. It undergoes, Doc, a certain practice na proven na po talaga na effective. Desired outcome. Okay, Doc.
It's based on research. Okay? Not a simple like survey research, but really, a real research. Okay, a rigorous one. Not once, but have been replicated over and over and over. That's only when it becomes evidence-based. Okay? So we say a proven practice based on research. Okay, so that's what that means, evidence-based or research-based. That's what it is. Okay? So with MI, it's been studied repeatedly. Okay, so there are strong evidence that it is really effective. Next is effective across populations and cultures. Why? Because motivation is a universal phenomenon. I mean, we go through that every day. So regardless of race, culture. Okay, so MI, especially MI, is transcultural, right? It's transcultural, meaning across cultures, it is true. Okay, so uh, it has a universal application, in other words. Applicable to a wide range of professional disciplines. Like I told you, the two guys who developed the model are from two different disciplines. One medicine and another one is actually counseling. So you can use it in sales. Yeah. All right. If you walk into a car dealership, actually they have their own way of motivating you to buy the product. Yes. So all salesmen have developed a way of, motivating. Sometimes you wonder, why did I buy this thing? I don't really need it. So that means that actually the salesperson who sold you that was very effective in convincing you and motivating you to buy the product. Okay. So yeah, across disciplines. Effective in brief or longer encounters. Brief or longer encounters, right? So it could be a few sessions, right? Or it could be a series of sessions. The thing with this is once a person is motivated, you really don't have to do anything after that. Okay? So there is a point where you have to stop motivating the person. The person is already motivating. We'll talk about that when we discuss stages of change model. Okay? Because the two are actually very complementary. MI and the stages of change, right? You familiar with the stages of change by Clemente, Nore, Prochaska, and Norris, right? Those three guys, right? So we'll talk about that as well. I added that a little bit. I'll touch on that. Okay. All right. So which part of in what stages of change we can use MI and at what point we don't have to use it anymore. Okay, so next is counselor myth of the unmotivated client. All right, so our clients come in, right? I would say 99% of them are not really motivated to change. Is that correct? About 99%. Very few come in here that say I'm ready. I'm ready. So many of them are not motivated. Okay, so the kind of clients that we have are not different from clients who are diabetic, hypertensive. Seriously. Okay, it's a different condition, but you will see the motivation, right? Our motivation to even cut down on sugar, right, fluctuates. And a lot of times we struggle in developing that and being consistent with with the diet, right? No different than our clients. They struggle with really making that commitment to change their behavior and stop using drugs. We should be able to relate to that. But come a point when actually we develop motivation. That's when your doctor says you have 1 month to live. Do it or die. Right? Okay. You don't want to get to that point, right? Okay. Same thing with the judge. When the judge says, listen, okay, if I get another negative report from the TRC, you're going to serve your sentence. You know what you're facing? You're facing 6 to 7 years in prison. Okay? In prison. Hopefully that would be enough for a client to really shape up. You'll be surprised that oftentimes that's not enough. Okay? In the same way, you will find out later on that people are already like the threat of death because of their medical condition is there, but they still continue to do it. Okay? Alright, so people can be motivated. Alright? The only person who can actually not be motivated is a person who really likes to die already right now. Suicidal people. They're motivated to kill themselves. That's it. They don't want to think about anything else. Just take the exit, end it all, right? But until then, there is always a motivation in people, right? Even the most unmotivated clients there, they have motivation, right? They're motivated to do the wrong thing. They're motivated to use drugs. That's motivation, right? A desire to do something, that's motivation, except it's a misdirected motivation. Okay, so there is always motivation in people, okay? The thing is to harness that motivation and rechannel it. That's what, that's where the challenge lies, okay? Actively involves individual in own care. Yes, it's not us. We are helping them develop that desire, helping them develop an internal desire to do something different, okay, to give up using drugs. Consistent with person-centered, trauma-informed, recovery-oriented approach. It's consistent to our model, isn't it? Yeah, we're trying to be trauma-informed, right? We're recovery-oriented. Recovery-oriented means giving up drugs, not substituting something to the drug, right? Okay, so we are that model. Person-centered. Do we individualize our approach? We are trying to. In the individual treatment plan, right? That's the only area in TC where we individualize our approach, correct? You understand? Without a treatment plan, we are mass treating people and using the same thing over and over to all people, right? Across the board. Okay? So, we individualize our approach to the individual treatment plan. Okay. And we'll talk about person-centered or client-centered model, okay? Because that is part of MI. Improves adherence and retention and care. Okay? Promotes healthy helping role for care providers. A healthy helping role. We are not doing the work all the time. When you find yourself so tired, right, in trying to help somebody, you're feeling that way because you're doing all the work. That's a sign that you have to stop and reevaluate what you're doing. Maybe you're doing all the work. That's why you feel that way. It should be the other way around. The client should be working very hard, to help himself. Okay? All right. Improves care providers' retention and caring. Now we can keep clients longer. Okay? Instills hope and fosters lasting change. The client, if the client is not hopeful that he can actually change, he'll not do anything different. Okay? So there should be hope. So part of the outcome of what we do is to actually instill hope that he can change. Many of our clients, or some of them, believe that they cannot really change. We've had clients like that who said, I tried this already. It didn't work. Right? What is he trying to say? I'm not willing to do anything different. Because I tried that already and it didn't work. So, in other words, he's not hopeful that things could change for him, right? So, the idea of MI is to change that. Okay? And hopefully, that would be the beginning of a lasting change for the client. Alright? Okay, why not MI? For the client. Already in action phase of change. He's already motivated. Right? He's already not doing the right thing. He's into it already. So, there is no need to actually keep trying to motivate him. He's already motivated. And we will know when we reach that point. Right? Do you know when a client is really genuinely motivated? He's not pulling your leg or trying to manipulate you. Can you tell? Who is paying you? Nakadulog ka. Not that. Okay. Okay, so blood flowing from the boots. The guy is doing it already, right? Trying his best. Okay? He's putting it into action. That's what that means. You don't need MI anymore. For us, when not to use MI? When you know what's best for the client. All right? When your attitude is, I know how to fix this guy. Do we have those people around us? Do we have people, excuse me, do we have people who like, I know best? Yeah. And very often, they really don't know what's best for the client. He thinks he knows. Okay, so he's using that perspective. We have people who are in recovery working for us, right? The drawback of that sometimes is they're really convinced what helped them change, right, will also apply to other residents. Okay? That's not always true. What worked for you might not work for another person. Okay? And that's what I see sometimes. Those are the counselors says, I know best for you. I've been there. I used drugs. I did all of that. Yeah, sure. Yeah, you did. But he has a different brain. He has a different history. Right? You have to be mindful of that. So you cannot always claim that I know best all the time to clients. So be open to what the client is telling you he needs. Okay? So otherwise, you will have a clash with the client. You're imposing your will on the client. That's not MI, okay? Guys, that's not MI. MI is trying to find out what the client wants, okay? What the client wants. And looking at if what he wants is consistent to what is, the expectation from our program. You might actually know what the client needs to do, but you cannot keep telling the client this is what you do. You have to sell it to the client, right? You have to sell it to the client until the client realizes that this is what to do. Very often we know what's best for them. True, right? But we cannot impose that all the time. They have to actually realize it. So there is such thing as going ahead of your client. Going ahead of your client, okay? So helping is not us, okay? Not us, always ahead of the client. And asking the client, follow me, right? Follow me. The client is refusing not to follow you. What happens now? Because you're too ahead. He's not there yet. MI is like walking. Walk with the client in tandem. Walk with the client together. Okay? It's a different way of working. Adrenaline junkie is another one. You know what's adrenaline junkie? Excitement. Excitement. You know, I know some counselor, you know what they do? They lit up fires all over the place, right? And then he tries to fix it. He creates crisis. He creates crisis in a TC. He creates a crisis and then come up with a solution how to fix it, right? Because it gives him that adrenaline, you know, right? No, that's not MI. You know, if you're looking like we are, how do you call those? Always looking for excitement, you know, things to do that excites him. Otherwise, he's bored, right? In MI, there are a lot of times when the client is not saying anything, right? Like there is nothing happening, right? And you feel like, man, you know, I'm not really doing my job. The client is not responding, right? The client is not talking to me. The client is not saying things that I'm expecting or I want to hear, right? So it's useless. It's a waste of time to talk to this client, right? Who has felt that way? Like your client doesn't really like respond to you, right? No, you cannot create excitement by, you know, by threatening the clients. If you don't respond, I'm gonna send you to wash all the dishes, right? You better talk to me. You better respond. All right, we cannot do that. That's not MI. Think of what changes do you hope to see, right? What changes? Yeah, you can have an idea. What changes do you hope to see, okay, from the client? And what are your goals? What are your goals for the client? You've got to have some goals. And you don't have to discuss with the client. That's your goal. You set for yourself, for the clients, okay? So it's okay to have goals. Okay? All right. But you cannot impose that on the client. That's your own. To guide you, you know, with your work. Okay? Do you have a copy of all of these slides? Do you have a copy now? Okay. This one, I changed it a little bit, so you might want to get the revised one. It's actually in that laptop. You know, what we're using is a revised one. I added just a few things in it, you know. Okay. Why don't people change even when faced with serious negative consequences? Good question. Why do you think? Why do you think we refuse to change even though we're faced with even possible death? Why? Right? I can tell you different stories of people who just had like a serious medical emergency because of lifestyle. Okay? And before you know it, he's back to it. He died, almost died. Okay? Amazing, right? So why? Why do people do that? That having had a heart attack would be enough to persuade a man to quit smoking, change his diet, exercise more, and take his medication. The doctors. Have you encountered people like that? Amazing, right? Yes. Yes. I'll tell you a story. This is real. These are my peers who go around and teach, you know, with their trainers, my co-trainers. One, she has a PhD, okay? Also. Had three surgeries, right? Major blockage in her heart. And she smokes. So she went to the hospital, had the surgery, right? And after recovery, right? You would imagine that she would actually quit smoking. No! She was back. She was training with us. So, you know, we joke, you know, we tease her and say, how can you stand and tell people, you know, about motivational interviewing? You know, and, you know, you can't even do this. That's one. This is real. She's a lady, right? Okay. Another one. A guy. A chain smoker guy. He had a mild stroke while we were in China. And she was actually rushed to the hospital. Luckily, it was so mild. You know? But the doctor told him, you've got to stop smoking. Okay, so he was let go because they observed him and they cleared him. And he went back working. He was training when this happened. He was back working. You know, no severe medical consequences. He was fine. But he was a very mild stroke, right? And he's a chain smoker. You know what he did? Back to work, he's back smoking. Okay? These are real stories. And I'm sure you too have encountered that. Okay? Diabetic already had, already amputee. You would think he would change his diet. No. You know what they would say? Life is short. Well, you're making it shorter. All right. Hangovers, damaged relationship, an auto crash, and memory blackouts would be enough to convince a woman to stop drinking. No. You know, in the US, they don't play around with that. I know some people who lost his license. Do you know in the US, after a certain point, when you keep actually breaking the law, driving under the influence, right? Under the influence, there come a point where you would lose your license forever. Forever. We have a neighbor, right? And moved in, right? This has been 8 years already, or 9 years with us, our neighbor. This guy never left the house. And every time, my wife and I are wondering what's going on with this guy. Whenever, they have a car, and it's always the woman driving. We've never seen him drive for 8 years. Okay, so my wife and I were wondering whether he lost his license forever. Okay, and they never went on vacation. It stopped, right? Because he cannot drive. And probably the wife, doesn't like to drive, take a long drive. So they're stuck there, and my wife and I just wondering what happened to this guy, because they're from Long Island, another place, moved upstate, from where we live. So our guess is he lost his license permanently. They in the US, they don't play around with this, okay? So that means that if that is true, he had a series of accidents related to drinking and driving. And it's not uncommon, by the way. Both men and women, they would lose their license because they would continue to drink. Okay? That the very real threats of blindness, amputations, and other complications from diabetes would be enough to motivate weight loss and glycemic control. How many patients do you have? No. The doctors. How many patients have you encountered who actually are like that? They know they have. Or how many of you continue to actually indulge in those, do not control your diet? Yeah, I salute you, Romel. Okay, so he was willing, to give up rice is a big sacrifice. Some people say, I'd rather give up my wife than rice. That's severe addiction right there. Okay, you understand? Okay, especially, the way we eat, right? I experienced that. I control my sugar. I'm not on medication. But I'm not waiting to be put on medication, to tell you frankly. Okay? I don't want that. Okay? I don't want to feel like, I have to take medication and then I have to go through, the changes that when my sugar is so high or it's too low, I have to feel a certain way. I don't want that. So I'm willing to give up rice. I love rice, don't get me wrong. I love rice. I love my champurrado and I love my lugaw. Okay, got it? Okay? Don't take that away from me. But then come a point, I cannot continue doing this. And you just have to give it up. Okay, because I want to feel healthy. I cannot do what I'm doing at my age unless I actually listen to my body. So I listen to my body very well. Okay? So, I know, some people say, hey, you can die anytime. Do, but I don't have to enhance my death. I can control it, to a certain extent, right? But it's very true. Okay, so what's the difference between the other people and me? Motivation. I'm motivated, and I have reasons to be motivated. Uh, there got to be reasons for everyone to be motivated. Is living longer not enough motivation? Is living with a better quality of life not enough motivation? Those are wonderful things, quality of life, longer life, right? But some people don't care. Right? It's puzzling, right? So, how do you discover what makes you motivated? That's the challenge in here. And that's a challenge for you doctors, right? To have those patients and work with them and really find what motivates them. And let's see if we can learn a technique, to actually accomplish it and reach that. So this is good for all of us. Doctors, psychologists, social workers, right? And especially working with our clients inside. Okay? That being homeless for years, having no money, feeling sick most of the time, hearing voices and being exposed to violence would be enough to convince someone to seek help to get off the streets. There are actually homeless people who refuse to leave the streets. Do you know that? Yes. They don't want to go into a shelter. They would rather sleep in a train or in abandoned houses. That one is mind-boggling, right? Okay, so that was included there because there are a lot of homeless who are using drugs, right, to help them cope with living in, outside, right? So it's not just being homeless; they're also using substances. It's to help motivate them to actually give up drugs and develop that willingness to get help. To get help. Next is that the risk of becoming infected with HIV. Big time, right? HIV is a major medical condition. But despite that, some people would continue to have unprotected sex. A real problem. Okay? Alright. So now we have so many examples of, people defying, what is good for them. And yet, it is often not enough, these things, not enough for people to motivate themselves to do something different. So why do people change? Client motivation is key to change. That's the key, motivation. Right? We all understand, hopefully, understand now, that's the key, motivation. Also in school, you do very well, right? Why? Because you're motivated, right? Same thing, right? In school, you're motivated to excel. Okay? Motivated to achieve your goal. And client motivation is greatly influenced by the provider, us. Us can influence our clients to develop motivation. Okay? Alright, so let's try this. Okay? We'll have, oh, maybe we should take a break first, right? It's 9:30, 9:35. All right. Why don't we take a break, 30 minutes, and be back here about 5 minutes past 10? How about that? 5 minutes past 10. To go out because I'm going to give instructions to the counselor. Okay, clients, go out that way and wait until I ask you to come in, okay? Clients, please go out. All right, come on. Okay, please make sure make sure you close that door, okay? All right. All right, counselors, pay attention. You might want to take note of this, okay? Okay, this is the instruction. Close the door, please. Okay. Your client feels stuck about making a particular change. Bibigyan ko din sila ng instruction, okay? Alright, the client is stuck with what they wanna do or change, okay? You are the all-knowing expert. You know what is best for the person. So you're the counselor from hell. Alright? You're going to tell your client what to do. If the client resists your advice, convince him why your plan is best. If that doesn't work, tell him to come back when he is ready. Okay, so you really just convince the client, that your strategy, your solution is the best. Okay, done? Okay. Alright, so when you're done, I'm going to ask them to come in, okay? And it's your turn to go out. All right, are you done, guys? Okay, please. I'm gonna ask them to come in now, and you're gonna go out. All right, clients, please come back. Come back. Okay, come out this way. Okay. All right, clients. Close the door, please. Clients, this is your instruction, okay? You're ambivalent about making a change. You have to think of something that you need to change or even trying to change, but you're struggling with it, okay? And you think that talking with a counselor might help you resolve your ambivalence, okay? So choose anything, health, exercise, okay, or something, that you've been struggling with, whatever it is. A choice or a decision that you're stuck. And choose an issue, exercise, diet, smoking, whatever. Okay, medication, food, going back to school, gambling. Describe both sides of your dilemma to the counselor, meaning my dilemmas are there. If I, let's say, going back to school, if I do that, it's gonna take up some of my top personal time. Okay, and I love my personal time. I love what I'm doing. On the other hand, I needed to actually study because I think my career will be better, if I have more education. I probably would have better jobs or get a promotion or whatever. Okay? So that's, you got it, guys? Everybody knows, you know what to do, right? Okay. All right. So you have to describe to your counselor the two sides of your dilemma. Okay. Good. All right. So, oh no, you don't. You're trying to set me up. Oh, oh. All right. I'm gonna call them in. All right, guys, come back in. Come back in. Wala kang partner. Okay. Here. Help me out. Okay. Now, naku, magiging maingay ito, no? Kasi marami kayo masyado. Alright, find, a place where you can talk. Alright? Okay, maybe you can take the chair and you can use the hallway if you want, okay? Or you can use this. Pagkasya kayo, okay. Find a space, okay? And you can start your counseling. Alright, fine. Okay. Believe me, it's gonna be very noisy. So you better get up and find a better place. Masyado kayong crowded yan. Get up, please. What? 5 minutes. Okay, 5 minutes. Alright. Hindi siya motivated eh. Nawala. Okay. Sino partner mo? Romeo. Oh. Sino? Yan. Okay. Alright. Do it 5 minutes, guys. 5 minutes. Starting now. All right, 2 minutes, 2 more minutes. One minute. Okay, time's up. Time's up. Please go back to your places. Go back to your places. All right. Sit. Stay there. Alright. Nag nag-eavesdrop sa ichichismis kayo niyan. Okay, so how did that work for you guys? How did it go? Okay, so who was able to convince his client? Was you were able to convince your client with your yes? Yes? Okay. Who used actually a real personal struggle? Yung real talaga, real. Raise your hands. Not make believe. Yung iba nag-role play eh. Okay. I told you to use your own personal issues. Right? Sino yung gumamit talaga ng personal struggle? Sino yun? Okay. Alright. Sino yung nag-role play? Sino yung nag-role play? Hindi talaga totoo yun. Okay. It's not gonna work if you role play. So from now on, ang mga exercises natin, for it to be real, is really real life experiences, okay? Okay, so this is just a warm up, okay? So we'll have a lot of other exercises. It's not, you're not gonna learn anything if you do not use a real personal struggle, right? Now, who has no personal struggle here? Like everything is fine. Sino yon? Sino yung perfect talaga yung buhay niya? Taas ang kamay. Ha? Okay. One, right? One way or another, lahat tayo, di ba? May struggle. Many of you are thinking of going to school, right? Because you want to advance in your career. But then, you think of, what does that mean? Right? What does that mean if I go back to school? Financially, or my time management, my family, the whole thing. Some of you are struggling with some medical issues probably, right? I mean, not really medical issues, but your doctor is telling you you've got to change something in the way you live, your lifestyle, right? Okay, so some of us are struggling with wanting to exercise more, but you cannot just to stay healthy. Some people are struggling with smoking. Okay, some people are struggling with just like you use a certain language outside, and then you come in here, right? And you want to just clean up your mouth because you're around the residents. Sometimes that can be a struggle for some people. They're so used to, right, conversing a certain way outside with your friends, but you cannot do that inside because you have the residents. You're teaching them a different way of behaving. Right? That could be a struggle, right? Trying to catch yourself when medyo dumudulas ka or nag-relapse ka, nag-slide back ka. There is always something you can talk about. Alright? So, next time, it got to be real. No role play. Alright. So, let's continue. Okay, so what you did is not actually MI, right? You know that. That was not motivation interviewing. But that's the normal, people who don't know MI, not exposed to MI, that's the way we counsel people, right? Like a friend, for example. You do that with a friend. Like, I know the answer to your problem. Believe me. Trust me, I know. Okay, just listen to me. Do this. You hear that all the time, right? Or your mom, right? Bibigyan ka ng Sermon of the Mount. Doon sa problema mo. And he will tell you that, believe me, I have been there. I did this, I did that, so you better listen to me, right? Okay, that's what family members, your big brother, your big sister would do. And even friends. That's not MI. A lot of times, what they say, come in here, comes out the other way, right? They do not motivate you. Sometimes you end up fighting with your friend. That can happen, right? And your friend is expecting you to listen to her or to him, and you refuse. And then he gets upset, or he or she gets upset because you're not listening to him or her. Have you had that situation? And your friend stops talking to you because you don't listen to them, right? Okay. So, yeah, real life. Okay, but that's not MI. And then, ang tendency natin, if we hear problems, is to correct the problem, right? It's called writing reflex. Writing reflex. We have a tendency to fix things right away. And sometimes without thinking, we just kind of do it, right? Okay, so that's not MI. The word is out of joint. Oh, curse, spite that ever. I was born to set it right. Yan. Parang yun ang vision mo sa buhay. To correct, whatever is wrong in this world. That's messianic, by the way. Okay? Thinking. Messianic thinking. When the writing reflex meets ambivalence, what happens? What happens when your desire to help somebody change because you believe you have the right solution to the problem, and then your friend or the client is ambivalent? Right? What happens? That is the expression right there. And there's trouble, you get resistance. Right? Resistance. That's what happens. Okay. So how do you deal with resistance? You do not threaten your client because your client is resistant, right? That's that MI. Okay. We are going to do the same thing. All right. Okay. So how about the same problem? Oh, come on. This time you got to change the problem thing. Okay, this has to be right, the real problem, right? Real struggles that you have. Okay? Okay. So, how about we do it this way? Okay, those counselors will become now the client. The counselor will become a client. So, who are those counselors who will become a client? Okay. All right, the client now in this round will have to go out because I'm going to give instruction to the counselor. So change role, okay? Go out that way. I'm gonna. Okay. Listen first. Okay. We have time. All right. So, your client is ambivalent about making a change. Elicit the person's thoughts and feelings about both sides of the issue. Okay, how do you do that? When he says, okay, I am ambivalent, I'm thinking, I'm in conflict. Usually that's the word they say. If I do this, okay, I don't know if it's gonna, how it's gonna change my life. On the other hand, I really need to do this. Both sides to explore and elicit the feelings, the thoughts about it, and how they feel about it. Okay, so thoughts, feelings about both sides of the issues. Simply seek to understand. You want to really understand. So I'm gonna ask them to do real life situations for them. Okay. Avoid giving helpful information or suggestion. Just listen and try to understand. Elicit more feelings by asking, how do you feel about that side of your ambivalence? How do you feel about that side of the ambivalence? What are your thoughts? What are your concerns? Okay? That's all. Do not dig. Do not do psychoanalysis, please. Okay? We are not doing psychoanalysis here. Okay? You want to really just understand the ambivalence. Are we clear? Okay. And then provide a brief summary of both sides of the client's ambivalence. After listening carefully, provide a summary of both sides of the ambivalence. Summarize. You know how to do summary? Everybody understand what summarize? To do a summary, summarize both sides, right? Or each side of the ambivalence. Okay. Elicit whether you missed or misheard anything or if the client wants to add something. So after you summarize, ask, did I miss anything with what we have talked about? Or do you want to add something that we missed or you missed? That's it, okay? Don't go too far. Just follow the instruction. If you know MI, don't try to bring it to the next level, okay? Keep it simple. That's the key. All right. So I'm gonna ask them in. Get ready. All right. Come back in. Come back in. All right. Find a comfortable place. This is gonna be serious, okay? Okay. So, yeah, go back to your spot. Alright? Okay, it has to be a real life issues, okay? So you might want to be a little more privacy there, right? You might not want to hear other people hear what's going on. Okay, that's a good spot. We have more space here in front, okay? More space here. Okay, listen, guys. I'm asking for you. Shh. Listen, I'm asking really real difficulties or struggle, okay? So some of those might be personal. So find a space where you're not you're not too close to other groups. There's a spot here if you want. There's a spot here if you want, okay? All right. So you've got to be comfortable, all right? Okay, let's do it. I'm going to give you another 5 minutes to do this. Another 5 minutes. All right, let's do it. 2 minutes. 2 minutes. All right, time's up. Okay, so how was that different? Okay, how was that different from the previous one? Well, okay, so you didn't say much, right? You just listen and elicit feelings, thoughts. Okay, all right. And was that for the clients? Was that a productive process for clients? Did you get something out of it? Although I know it's just 5 minutes. Did you get some insight or a different perspective? Yeah? Okay, so that's a different approach, right? Different approach from being told what to do. Okay. So eliciting versus imparting. You are only eliciting. You are not imparting. You're not teaching. You're not telling, but just eliciting. Okay? That's what you did. All right. 3 communication styles. Okay. Attitude and approach to helping people. So style is attitude and approach to helping people. Used for different purposes. Often intermixed. Following. That's what you did, right? Following. You were just following what the person is saying. Okay? Okay, and sometimes you need to direct, right? Those are the 3 things that what we call communication styles and guiding. The best part there is really just guide the clients, guide the direction of the conversation. Questions like, tell me more about this. Tell me more about that. That's how you're guiding, right? It's a form also of directing of the conversation, right? By asking more information in a particular aspect of the problem. Okay? All right. So, how did you see that when you were doing this, this the last exercise? Was that too difficult to do, to just listen? Did you exert more effort trying to convince a client versus just following and listening? That's easier. Is that easier than telling the client what to do? A lot of times, yes. Right, right. Just being able to listen and elicit, right? Not saying too much. Okay. Three core communication skills: asking. You know, asking, right? And listening. And the third one is informing. Okay, so when a client, especially when you're doing drug, when you talk about drug addiction, right? A lot of our clients don't know about alcohol. Although they abuse alcohol, they really don't know so much about alcohol, the dangers of alcohol, or the withdrawal symptoms of alcohol, that alcohol can cause blackouts. Very often, because they never probably experienced those yet, they don't know much about alcohol. And so you can actually tell a little bit about, inform them. Do you know that if you actually keep using it, you will develop addiction to alcohol? There is such addiction to alcohol. And some of them probably are already addicted to alcohol, but they never experience withdrawal because they don't stop. Or when they lessen their intake, they begin to experience some withdrawal symptoms. They don't understand that, right? That's because of the drug or because of their body being addicted to the drug. So you can inform them, a little bit about that. So there is some room to educating the client a little bit about the drug so they understand. You have to remember they're trying to make some choices, right? So they have to understand a little bit about what are some of the consequences of the choices they make. So they say, oh, let's say, you have an alcoholic and somebody who drinks regularly and he never really stops. So he says, okay, I really want to quit right away. I know I have to stop using. So you might have to tell them you're going to experience some unpleasant, you'll have unpleasant experience. Tell them that beforehand, right? To anticipate that. Okay, so they know what they're getting into. Okay, so don't assume that they know what's going to happen, or you don't, you're not anticipating what could possibly happen if they stop taking alcohol. So you have to anticipate and you have to inform them so they know what to expect. Okay, because if you don't, the moment they feel uncomfortable, they'll go back to drinking. But if they know that is part of the process of giving up alcohol, then they can prepare their mind ahead of time. Does that make sense? Okay. So the spirit of motivational interviewing. There's no such thing as teaching, only learning. Yeah. So teachers like me, like trainers like me, I continually learn. Every time I do training, I learn at the same time while I am actually teaching. So to me, that's all. That's what life is all about, learning. Okay. Okay. Well, the spirit of motivation interviewing, collaborative, working with the client. Okay. A partnership honors clients' expertise and perspectives. At the end of the day, who is really expert about the client's problem, you or them? damn, they've been struggling with it. They probably tried different things, you know, right, to address the problem. So they have a lot of exposure to trying to fix the problem. Don't don't assume that they did not do anything. There might be some moments that they really think about quitting or doing something different, right? So they tried something, but it didn't work, right? And they have tried several ways, but they always fail. But there is a lot of learning in that. So they have developed some understanding about some of the challenges. Okay? So they really are experts about the problem. Between you and them, they know more about their problem, their personal problem. So honor that expertise and honor that perspective. Evocative. You know what it is to evoke, right? Evoke. You're trying to evoke something, the feelings of clients you evoke. So that's, yeah. Resources and motivation presume to reside within the client. You want to bring it out. Bring it out, that resources, the client's resources, right? And then empowering. How do you empower a client? Affirming the clients. His right and capacity for self-direction facilitates informed choice. Okay, so the slightest effort that they make, even though it's too small, affirm it. All that they failed, affirm it. And just for trying, right? Affirm that. Even though it didn't work out, but he tried. Okay? So that's empowering. We are, it reminds me of validation. We are very lousy when it comes to affirming or validating people, right? We are excellent in trying, in finding what does not work. We're expert in identifying what doesn't work, right? It's almost like it's our instinct to find what is wrong. You realize that? Yeah. Okay. So, because at the back of your mind, if I do not identify what is wrong, then I don't know what to fix, correct? Alright. That's what's going on in our head. But we forget also to actually affirm the other things that clients do right. It cannot be always wrong. They cannot be always wrong. They must have done something right even though it's small. Or maybe it's not enough to change the direct trajectory of their lives. Okay? Find those. Find those things they did right. And build on it. Okay? And affirm the client. So always we say, when we work with the clients, when they talk about something, affirm, be quick to affirm the clients. Oh, I appreciate you actually telling me that. And that's cumulative. That trust cumulative. And that's how you also build rapport with them. Right? Have you heard of clients says, oh, I like talking to so-and-so. Right? Because every time I talk to the client, I really feel good about myself. You hear that, right? But they cannot pinpoint what is it that the counselor did that make you feel good about that session. And a lot of times because of those affirmations, validation, acknowledgement. Okay? Alright? The spirit of grace. Gentle, respectful, accepting. What is accepting? Be non-judgmental. Okay? Collaborative. Working with them. And eliciting. Always trying to elicit. Bring it out. Okay? Bring out what is hidden. Bring out what is not obvious. Because when you bring it out from them, they are surprised to see, right? They're surprised to see their strength, their capacity, their resiliency. Listen, our clients are so used to hearing negative things about themselves, correct? So the moment you affirm them, they just like love you for doing that. Because, like I said, they're so used to being judged, being told that they failed, they're a failure, right? But for the first time, you're affirming them about some of the things they did right. That changes the dynamics, that changes the relationship. All of a sudden, you're seeing them, and they would tell you, I appreciate you. You really understand my situation, right? All you did is actually ask them to tell you, both sides of whatever is going on with it. You're just asking them to tell you. But they interpret that you understand, right? Hospitality. You understand what it is, right? Be hospitable, be accommodating, right? Okay? And you should love their story. A good story, their story. What's your story? Tell me about your song. Tell me about, this thing, that story. They encourage them to tell story. That's called narrative, creating a narrative. Okay? Listen, a lot of those narratives are very negative, right? Because that's what they know. That's what they heard. Okay? And then in the process of counseling, okay, because they develop perspective and understanding, that narrative is going to change later. From being a failure to something like, I have hope. I can do this. Because you show it to them that they're capable of doing that. Okay? And care. Always communicate that you care. Now, you cannot fake it, right? So it should be congruent. Your body language, right, your facial expression should be congruent to what the expression of care, okay? That you care, right, for them. Okay, you can't fake it. They know if you really care or not. They can sense it, okay? The risk of hope. Listen to this. This is deep, right? Often people who have suffered many losses relinquish hope as a means of survival. Do you understand what this is trying to say? Right? What is it trying to say? How do you say that in another way? How is it that relinquishing hope, giving up hope, is a survival means for people who repeatedly suffer setbacks in life? Explain that. Who can explain that? Romel?
Sir, para siyang learned helplessness na parang gano'n na. Well, parang nagiging defense na lang nila na wala nang pag-asa, so meron na silang learned helplessness. Parang gano'n.
Anyone else?
Pag wala na kasing hope, Doc, so, pag nag-give up na sila, hindi na sila madi-disappoint. No more disappointment.
They don't have to expect anything anymore. Okay? Because what happens when you keep hoping that things will be different, it doesn't happen. Repeatedly. It takes its toll on you. It does. It takes its toll on you. So, for you not to suffer anymore, you should just give up hope. It's always expect, things are gonna go wrong all the time. So, no hope, right? Just to survive. But you see, the absence of hope is not good also, because then, why make an effort? Why change? And a lot of times, that's what, severely people who are severely mentally disturbed or suffer tremendous losses in life, people with PTSD, for example, like that, they don't have much hope. They accepted their condition and they do not hope to change that. Okay, that's why it's very hard to actually work with them. Okay, because they have given up hope, which means they also have no motivation to do something different, to things, to fix the problem. Okay? People who believe they're likely to change do so. You believe in that? If they believe they can change, they'll be able to change. But if they don't believe they can change, nothing's going to happen. People whose counselors believe that they are likely to change do so. These are based on research, by the way. This is a summary of studies done on an outcome research on counseling. Okay? This is based on facts. Okay, so if your counselor believes that you can change, you're likely to change. Okay? Those who are told that they are not expected to improve, indeed do not. Okay, so that's a study done by Miller and Rolnick. It's based on facts. Okay, there is nothing about a caterpillar which would suggest that it will turn into a butterfly. You see those wood, no? The caterpillar. Diba? Who would like to touch a caterpillar? You like touching caterpillar? You are weird. I don't like the I don't like the looks of them. Okay. Yeah, they elicit like, right? Okay. Caterpillars are not very attractive to look at, right? Except for Joanna, he likes caterpillars. He likes caterpillars. Okay. Seriously, right? There is nothing about caterpillars that, it will turn out to be a butterfly, right? Nothing about it. Okay? So, that's what happens with the caterpillar, and this is the caterpillar. Right? Okay. Yeah. All right. But that's also one of those wonderful things about nature. Like, never expected that to be. When I was young, I cannot make the connection. I didn't know that wood, no, is going to turn into. I didn't know that. It's only like later on I realized, the chrysalis, right? They turn into a chrysalis and then they become like a cat. But I go, wow, that's magic. That's nature's magic, right? Okay, now, these are the pillars, right, of am I. First, express empathy. I will break this down one by one. Then develop discrepancy. Roll with resistance. And supports of efficacy. Okay. Oh, by the way, you find some of those, like looking at it, oh, okay. Those are combinations of different theories. You know that, right? That's why MI is a trans-theoretical model. You know what that means, trans-theoretical? It borrowed theories and concepts from other sources, mostly from social psychology, also from cognitive behavioral psychology, okay? Cognitive behavior, they borrowed some of those. So that's why it's called trans-theoretical model, okay? And then we'll break it down, where those things came from. Okay, so everybody understands what's empathy, right? Okay, we talked about what's empathy already earlier. Okay, express empathy. Now we're talking about the counselor, right? The ability to express empathy or the ability to empathize with someone. Acceptance facilitates change, okay? So, communicate acceptance. That you are not judging the client. Okay? Okay, and again, facilitating empathy, skillful reflective listening is fundamental. Okay, we'll talk about what is reflective listening. Okay? This becomes a little bit more difficult. Okay? The ability to actually reflect and listen reflectively. Remember reflective and reflexive? Okay. So, we're not talking about reflexive. Reflexive is pakitang tao lang yan, hindi talaga malalim. This one is reflective listening. Okay, ambivalence is normal. Okay, to feel like in conflict with things in life is normal. Okay? Alright, so everybody understand what's express empathy? That's the first of those four. Alright, next is develop discrepancy. This is actually the key. Alright, in I would say an important part of that for principles. Okay, you know where they took that discrepancy thing? It's from social psychology. Okay, so there was a book that came out explaining what's cognitive theory by Kissinger. I explained to you what's cognitive dissonance, right? Cognitive dissonance. So that theory was very helpful actually in counseling. That's the key to actually setting up chains to create cognitive dissonance. In MI, it's called creating discrepancy. It's the same concept. It's borrowed from Kissinger's cognitive dissonance. Any form of counseling uses actually cognitive dissonance. Remember what I said to create anxiety? How do you create anxiety? You create anxiety by pointing out discrepancy between a person's behavior and what he or she hopes to achieve. Right? For example, a client would say, I really want to get along with my mother. Okay, I'm trying my best to get along with my mother. Okay, so if you analyze what the struggle is, well, as long as he continues to actually using drugs, there is no way that he will be able to get along with his mother. Okay? Correct? So, he says, I've been trying my best to get along with my mother. No, you're not trying your best. I mean, of course, you're not going to tell your clients that, right? But in reality, you're not really, inside in yourself, you're not really trying your best because it's very easy to get along with your mother. Just stop using drugs, and it's going to happen. So you gently point out, okay, you wanted to get along with your mother. Wonderful. That's great, But let's see. Okay, so what is it that your mother and you, what's the normal source of conflict? Why you and your mother are not getting along? You know what he would say? Oh, because, he wants me to do this, he wants me to do that. And usually he would skip about the drug thing. Okay? He wants me to do this, or to do that, and I'm not ready to do that. Okay, is that all? Okay, so you try to actually explore that, right, until he says, yeah, okay, using drugs. Do you think that has something to do with the problem communicating, getting with your mother? Okay, so now you want to actually get along with your mother, but you are telling me that you continue to use drugs, right? So how are you going to get along with your mother when your mother has been trying to encourage you to stop using drugs because that's what's causing the problem, right? So you continue to use, you ended up in here, right? But you wanted to get along with your mother. So you highlight the discrepancy between his goal, what he wants to achieve, and what he's actually doing. That's creating discrepancy, right? When you do that, you just do it gently. I may not be doing it very gently, but do it gently so that, he continues to listen to you. Alright? Okay, so that technique is a little bit, you need a lot of skills to actually set it up. Okay? Change is motivated by perceived discrepancy between present behavior and important personal goals or values. Client rather than clinician should present arguments for change. The client should argue, right, rather than you arguing for change. Okay, so how do you move the client to that point? That's not easy again, okay? Easier said than done, but that's not an easy process to achieve. How do you apply this principle in using the TC behavior shaping tools? Tell me, can you apply the concept of cognitive dissonance or creating cognitive dissonance in the application of the behavior shaping tools? Okay, program people. Come on. How do you apply that concept or theory in the application of behavior shaping tools? All right, I'll give you a situation. Okay, you're doing a haircut. Somebody repeatedly break the house rules. Okay, so now you sit there and you address the client. How are you going to set up the discrepancy? Or can you actually set up the discrepancy while you are addressing the client's behavior? Are you following me, guys? Because this is something important. This is how we can transform the behavior shaping tool as not just hollering and shouting, right, the clients or putting down the clients, but doing something that is actually based on science, right? Okay, so how are you going to set up the conversation in a haircut, for example? Or how about this? Clients keep overstaying in bed. If you have clients like that, they don't get up on when it's rising time. Is that a problem? No, not a problem. Tell me a behavioral problem that is common inside. Breaking what rules they often break. Come on. Come on.
But exchanging of food, because the clients there have their individual diets prescribed by the physician.
Okay. Oh, they keep cheating on the food. All right. Good. All right. Now you understand what is creating discrepancy, right? You understand that, right? How do you create discrepancy for the client? What would be the narrative? What would be the dialogue? How does it look like? You're trying to actually create dissonance, right? You're trying to change that behavior, correct? In the haircut. Okay, so how are you going to talk to the client in that haircut? The problem is he is not following nutritional recommendation, right? To address his medical problem. Okay, that's the issue. So how are you going to address the clients in that haircut or whatever, talking to whatever, Okay. Come on. Okay, Nico.
Hello, Doc. Siguro I ask the client if...
No, you're not going to ask. Right? In the haircut, you're not asking, correct?
I'll remind the client if which is the haircut or
Okay.
do some actions to rectify that exchange.
Okay.
Diet.
How do you gonna create? Now, you are talking. In a haircut, you are not asking, correct? They cannot respond to you. You are just telling him. So, in that process of telling the client, how can you actually create discrepancy between, what he is doing and what he needed to do to keep his health? Right? Anyone? All right. Dr. Dial.
Maybe a statement would go like this. You want to lower or control your sugar, and yet you are not following the instruction of the doctor.
All right. Good. So you can say you agree and you know, right? And you want to decrease your sugar, blood sugar, right? But, okay, here is actually what's going on. You continue to eat without regard to what you want to accomplish, right? All right, so you are actually making a contrast between what he wants to achieve and what he is continuing to do, right? And then you follow up, I know you can do better than that. You understand? So you set up already the dissonance and you say, I know you can do better. I know that you can do that. But we are not seeing that. So what's going on? So you create both dissonance and guilt at the same time. Remember what I said? When you create guilt, the tendency is to rectify the situation so they don't have to feel guilty, because still guilt is a product of this cognitive dissonance too. Correct? Yes. Okay, so right there, you can apply cognitive dissonance in a haircut or intervention. Always just remember that. You create anxiety, discomfort about the behavior that they're doing and what it is that they want to achieve. Isn't it wonderful that we could actually use that? The whole idea of a haircut is creating cognitive dissonance. That's the whole thing. Right? So here is an application of a theory, in that. So now, when you try to explain what's the value of behavior shaping tools, that's a good way to explain it. It makes more sense, doesn't it? Yeah? Okay. So we change that the way that intervention is implemented. Can we do that? How do you teach the client to do that? You set the example. Okay, you set the example. So do stop sit in a haircut, the staff, or you just let the client do it. How do you guys do haircuts? Do you supervise the haircut? Do you sit in the haircut, or you don't? Come on, yes or no? What? How do you do that?
Doc, during haircut po, there is a staff present
Okay.
to supervise yung haircut po na kinakonduct sa mga residents.
Okay. So there is a stop.
Yes, Doc.
Okay. So you're saying that the staff doesn't talk, only the clients. Is that what it is?
Yes, Doc. That's it.
Okay.
That's with the practice.
Change that. Okay. The staff actually in a haircut talks and give direction to the client. Okay. How are you going to teach this client how to do it right if the staff doesn't actually say anything in a haircut? Alright? So change that process. The staff can talk and take a lead in a haircut. He's not just there to observe what's going on. He should be actively involved in a haircut. And this is how we're going to teach it to our clients. We teach it to the clients by showing to them how it works. When they hear that, believe me, they picked it up like that. Why? Because tinatamaan sila. You know what they will say? Wow, that really worked for me. I mean, he's not going to tell you that. But he says, that worked for me. Next time, when he sits in the panel, he will be copying you. He'll be doing the same thing. That's how you teach them. Before you know it, that's how they will be doing haircut. But you have to set the example and you have to teach them how it is done. Okay? So it looks like I need to really look at the way you implement your TC. It's something is missing in there. Okay? Really. Now, if we cannot fix it and really correct it, don't expect to have good products. Okay? We are not going to be producing strong, good products if we cannot fix it and make it better. Yes, Ivan. Okay, about 4. Or usually, if you count the stop, you have 5. Yes. Yes, everybody is here. Everybody. Okay, the stop basically takes the lead, right? And then the rest follow. Okay, so you are supervising at the same time, but you are actively involved in it. Okay? I don't see why a doctor cannot sit there and do behavior shaping tools. Why not, right, doc? Yeah. You know, guys, I hope really the doctors get more exposure to what's going on inside and take some participation. And maybe one day I see a doctor facilitating an encounter group. Okay? I know some of you, like the clients, love you, right? Okay? They lined up to see you and talk to you. We will turn it around. We will turn it around. Okay? So you facilitate an encounter group, and believe me, nobody is going to get up there, right, and do something stupid. Because he's going to try to impress the doctor, or, right? So here is Dr. Ems or Dr. Joey sitting in an encounter group, facilitating an encounter group, right? Why not, right? And believe me, yeah, and believe me, they'll probably listen. So we turn that around, right, into something more clinical, okay? So yeah, I can see that happening really. That would be wonderful, I don't know if you guys are open to doing some of those things. I know it's not the regular practice, not part of the regular routine of doctors, but why not? I know some doctors actually who are very good in running the TC. Doctors. Okay? Because you have the background. You pick up concepts. And like this, I know you got it. What I'm talking about. Right? And you can actually do it right away. Alright, so, yeah. Wow. Encounter group. Dr. Ems. Now, seriously, right? You cannot imagine them acting out in that encounter group if Dr. M sits there, right? They won't do that because they're trying to say, oh, I have to present my better self in this situation. They're still thinking about that, right? Yeah. Okay. And for that matter, not just Dr. M's or Dr. KR, it's everybody. The fact that the doctor sits in an encounter group, they will respect that. Oh, here's a doctor, wow, sitting in our encounter group. That's it. They'll be like, wow, it's a doctor. Right? Any one of you can sit there. And they begin to actually, you know what they're going to do? They're going to show off. They're going to show off that we can do this right. We're going to do this right because the doctor is there sitting in the encounter group. Okay, that's the outcome of that. Listen, I'll give you a scenario, right? Let's say there is a morning meeting, right? Morning meeting, and then you're a doctor, you just happen to be there observing the morning meeting, right? And all of a sudden, there is a pull-up, and the pull-up is a big deal. Not a small thing, but a big deal. And then you address the pull-up. You talk to address the people who were actually the subject of the pull-up. The whole room will be quiet there. Will be quiet because it's the doctor talking now. That's a tremendous impact to them. You understand? So, use that, use that status, the perception of you, right, into something really productive and really therapeutic. Yeah, you have tremendous impact on that. I walk in there and I think I'm a doctor. Yeah, I'm like a medical doctor. I walking in there. Okay, the whole thing like changes, right? Oh, he's a doctor. He's the doctor coming in. So everybody like the whole behavior, the whole attitude changes. They don't even know me, right? They just heard that there is a training, and that guy, is the trainer there. So I walk in there, and oh, he's interested in our facility. So everybody like shape up. Everybody greet me. Good morning, sir. Good morning. Okay? They don't even know me. You see? So all of you can have tremendous impact with them. You just have to show up there and kind of begin to actually share to them. They'll appreciate that. They will do. Surely they will. You run a seminar with them, right? A thesis seminar, like one of those written philosophy. They'll be like, their mind will be blown. They say, wow, he knows the TC. He can actually, you understand? And then they will begin, this is a good program. The doctor is talking about the TC. You know, he's not just like, you know, talking about my medical condition, but he's also talking about the therapeutic community. That has a lot of impact to them. Okay? And then they begin to think, everybody here like knows the TC. Right? And I told the engineer, because he texts me back and forth. And I said, you can also make a pull-up. Yeah, you can make a pull-up. Like if you see some staff who are not right, say something. Because you have a position in the organization. They have to respect that. And I'm sure they will respect that. Say something. Right? That's the whole idea, really, in our community. That we are all familiar with the culture and we just don't know it, but we practice it at the same time. Okay? And the dynamics is going to change, you know, if they can actually show you, oh, this is a very different place, you know. Our psychiatrist knows the TC, you know, he gives direction in morning meeting. He sits in the encounter group. He controls, he pulls people up, right? He wants to learn too. Okay, so next life you will be a counselor, okay? Okay, so you remember what you heard, right? Okay. All right. Does this make sense? Yeah? So I love this because I can see the application in TC. Okay? Roll with resistance. All right. So what does that mean? Roll with resistance. Ivan. Okay. Yeah. It just describes. Oh, the word. Why roll with resistance? Why not ignore resistance? Why? Why roll? Okay. It could be tolerate resistance, ignore resistance. But what does it mean to roll with it? Okay, it's actually an American English expression. Roll with things. What does it mean to roll with it? Roll with things. Go along with it. Roll with it. Go along with it. Why? You are trying not to fight it to create more resistance, right? So you oppose it, there will be more resistance, right? Okay. So when you roll with it, you are not creating any resistance, but you are aware you are rolling with it, with resistance. Okay, you are aware that there is resistance. That's what that means. Okay, avoid arguing for change. If you argue for change, you are taking a position. Guess what happens? You take a position and the client takes the opposite position. You notice that? And not just the clients, it's the nature of people. You take one position and they actually take the opposite position, and then it becomes a power struggle later on, an argument. Okay? Alright, resistance is not directly opposed in this model. Not directly opposed. Okay? We get around it. That's what it is. Okay? And find a different way to diminish that resistance. The new perspectives are offered but not imposed. How about, that's a good opening. How about this? How about that? What do you think if we do it this way? What do you think if you do it this way? Okay? You are not telling him, do it this way. You're asking him to think about it, right? No imposition. Plan is primary sources in finding answers. Explore with them. Why is this difficult for you to do? Why is it? Help me understand. Tell me more. Why this is a big problem? I want to really know. Right? That's the way you talk. Okay? And let them talk about and explain to you, right? Listen, have you have you had this experience of you have a dilemma, right? You have something like bothering in your head, something, but you don't know what the answer is. It could be like a personal issue right there. And then you begin to talk to your friend. You know, I don't know what to do with this situation. You know, it's been bothering me. I don't know what to do with it. You know, like every time my mom says this, it just kind of triggered me to feel a certain way. Just like I feel walking out from her, but I know that's very disrespectful, but I don't know what to do. Okay. So let's say that's a conversation. Have you had those kind of situations while you're talking about the problem, something comes in your mind and this lights up your head and says, oh shit, I know what to do. Have you had those? Have you had those? Because you heard yourself talking about the problem. You see, until you begin to verbalize, until you begin to talk about it, it's not really very clear in your mind. But now, it's clear because you're hearing it. That's the magic thing. So the more they talk, in the same way, the more they talk, what's going on with them, something will light up in their head and says, oh my God, that's the answer to this. Sometimes they will not tell you that. I will not tell you that. But he has gained insight. All of a sudden, something lit up in their head and they, okay, now I know. Right? Have you had those aha moments in your life? Yes, all of us been there. And that's why we keep exploring. We keep asking them to talk. And there we're just listening, reflecting. And the more they talk about it, they begin to actually see it. Okay? They see better when they talk about something. The same thing with us. Right? We have a word like sounding board. Remember? You know sounding board. What's a sounding board? It is actually exactly that process. A sounding board is something where you can verbalize something that is fuzzy in your head, that's not clear. Then, you know, it bounces back to you, right? Bounces back to you and says, okay, I understand clearly now, right? But until you verbalize it, it's fuzzy in your head, right? That's the way our brain works. That's how our brain works. You heard the word like, I'm talking to myself. Yeah, sometimes you talk to yourself, right? When you are like, you hit a snag, you're doing something, hit a snag, and you're talking to yourself. If I do this, but it didn't work out. But if I do this, you know, you're talking to yourself, right? You're verbalizing actually what's going on there, you know, so your mind can process it better, right? Okay. That's the same thing. So verbalization actually helps you clarify things, doesn't it? Okay. And then when they are hearing verbalize, they're also listening to themselves when verbalizing things. Okay? Alright. That's the magic. Resistance is a signal to respond differently. So when you hit resistance, step back. Step back. That's the way. Not keep going. Not keep going. But step back. What is it that I hit there? Okay, client is not ready to hear it. Client is not ready to go there yet. Okay, so I'm going to move back, step back because I don't want to create more resistance. Because when you keep going, what happens? Resistance increases, right? And then the more you go, the more the resistance. The more the resistance, right? That is not productive at all. You're not going to accomplish anything with that. You got it, guys? That is rolling with resistance. Is it clear? Questions about that? No? Okay, good. Finally, support self-efficacy. Alright. Based on studies, there are a lot of studies done on self-efficacy to be related to ability to decide to change. Okay, it's a finding that when client, first of all, client must feel empowered, that he is capable of doing something. okay, then the chances of him doing what needs to happen is higher. The capacity to do something is called self-efficacy. So what we are trying to do at the same time in here to increase the level of self-efficacy, you understand, some of those affirmations that we make during the counseling session is to empower the client. So little things that they did, right? Even though it did not work, but it is an effort towards the right direction, you affirm that. You affirm that. I say, wow, that's great that you tried that. I know it didn't work out, but that, that is great that you tried. Okay? Or sometimes you say, even though things doesn't look doesn't look bright for you, but you keep trying. Those little things that you affirm about their efforts, it accumulates. What it is to increase the level of efficacy. Self-efficacy is the ability to do something, to change things. That's what it is. Okay? So, the higher the level of self-efficacy, the likely that the person will change his behavior. Okay, so it's research-based again. Okay? Belief in the possibility of change is an important motivator. Okay? Client, not the counselor, is responsible for choosing and implementing change. Remember that. It's the client. They choose and they implement what it is that they want to change. Okay, so you have to be careful. Sometimes they have very modest goal, right? As long as that goal is in the right direction, if it is modest, it's okay. Work with that. And when the client achieves it, he will not stop there. He says, wow, I can do that. Probably I can do more. That's self-efficacy. Right? Don't set up big goals in the beginning. Maybe let them set what they can do. How about that? Set it up. What is it that he wants to do? Baby steps. Right? It's called incremental, not global. We accept incremental change than global change. Global change is overwhelming. Right? Incremental change is doable. Small chunks, small pieces. That's more doable, right? So when clients begin to achieve success, even though it's a small step, it piles up, it accumulates, it empowers them, it increases their self-efficacy. But when they fail because we set up big goals for them, or rather they set up big goals for themselves, it's a setback. Okay? Providers on belief in the person's ability to change becomes self-fulfilling prophecy, isn't it? Our belief in their ability to change becomes a self-fulfilling prophecy. In the same way, if they don't think they can change, it becomes a self-fulfilling prophecy. Okay? Alright. Again, motivational interviewing, a client-centered, goal-oriented method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. Let's go back to this. The 4 principles. Questions about it. Okay? I don't want to move on to another topic unless we clarify this, because this is one of the pillars of MI. Okay? Questions, comments? Yes, Dr. Jolin.
Doc, I'm just wondering if in all group therapies that we're going to conduct, or be it static group, encounter group, are we going to incorporate the MI?
Good question. Remember what I said, MI it has to be like a part of our style, Dr. Jolin. So when it becomes part of our style, it will come out in our one-on-one, in our groups. Let it be just a natural way of doing things. It's a change, it's a paradigm shift in the way we do things. You understand what's a paradigm shift? Right? A paradigm shift is a new way, a new perspective of looking at a situation and going about to address it, right? That's a paradigm shift. Okay, so it should be like becomes part of our style. You understand what I'm talking about? When it becomes part of your style, it will just come out naturally. When you talk to a client, when you're implementing BST, when you're talking, even when you're talking to a client in the hallway, right? Yeah, of course, when you're implementing the haircut, it'll just come out, right? Because that is part of you. In other words, you have internalized the spirit of MI. Okay, Dr. Jelen, you have actually internalized the spirit. It will just come out naturally. All right. So it will take time. I want you to digest it, process it. So, hopefully, like I said, it is too ambitious to tell, after 2 days, I can actually shift your mind. I'm not going to be able to do that. But that's a good beginning, for you to understand it. Your mind buying it and say, okay, this makes sense. I'm going to try it. I'm going to do it. Okay? I'm selling it to you. That's all.
Doc, I'm asking that question po kasi most of the time when I'm observing someone, so from behind the scene po, parang I was able to listen to some of their, not all naman, na nagbibigay ng advice. Parang we tend to give more advice than doing the MI. Eh, ako po, guilty din po ako doon. Honestly, minsan nagagawa ko po kasi I have not yet fully actually incorporate the MI po. Pero now that you've introduced this to us, I think it's a matter of practicing po talaga so that we could be used to it po.
All right, Dr. Jelen, we are all guilty of that. The writing reflex is part of us. Okay? All counselors have a writing reflex. The tendency to give advice. Alright? Okay, so we just have to change it, right? Okay. So, yes, I know. We kill our clients by giving too much advice. Yeah. So, instead of eliciting, right? Let them verbalize. What is the conflict? What is the difficulty? Tell me, explain to me. Why you struggle about this particular behavior? Tell me more about that. What's going on? Tell me. And listen. He'll find the answer. Okay? Once it gets clear in his head, he's likely to actually change the behavior. But what happens when we are actually keep advising him? Well, it raises resistance, right? Because they are ready to do what it is you're telling them. They are ready to actually implement that. It's a waste of time, really. Because you know what? When you're telling them what to do and they're not ready to do it, they have resistance, correct? And once they have resistance, whatever you're saying is coming in here, coming out there. You know that, right? Look at their eyes when you're giving them advice. And look at their facial expression when you're saying that. You know what their eyes is saying? Get over it. Get over it. Please. I have better things to do. They're not saying that, but that's what you see in the eyes. Okay, hurry up. Finish what you're saying. That's what they're saying, right? Okay. Right? And then they look at you. Okay. Done. They're happy. They go. You know, right? They cannot wait to get out of there. Because they had it already. That's what it means, right? When they linger after you talk to them, that's different, right? They hang out there a little bit more, like, more, tell me more, give me more, right? That's not what you get when you're trying to actually give advice all the time. And before you know it, sister, kaalis na ka dito. Because he's gonna talk to me and give me, okay? Okay, so you know what I'm talking about. about, right? That's not the kind of behavior we want to elicit from our client, right? Yes, Doc.
I'll just share an experience po based from the report of my caseload managers po. There's this patient po, remember yung si Cristobal, yung matagal na nandito na almost 1 year. Crisologo pala, sorry. Kasi Doc, ang sabi niya, parang na-master na daw niya lahat ng program dito, nabobore na siya. Para nangyari, ang natutunan niya is yung routine, the routine. Pero wala siyang na-mention something about yung, may natutunan pero not that deep. Kung ganito po yung in-apply siguro namin, baka po mas iba po yung marinig namin. So, yun po naisip ko.
You want to hear from them, I learned a lot about myself. That's what you want to hear. Okay? So when they learn more about themselves, I mean, it's forever learning, right? You know, that doesn't get exhausted. Then they feel like, wow, really, my time here is useful because I learn a lot about myself. I begin to understand myself better. That should be what they were saying, right? Learning the routine, our regimen in here, that's not important. That's not the most important. Those are vehicles to help them, you know, but that's not it. Okay? All right. Questions, comments? Anything more clarification? Affirmation? You know, things that you have tried before, similar to this one? Anyone? So quiet. Oh, what's going on? Are you digesting? Yes, Ivan.
It's more like a comment na lang po, Doc, or sharing about my experience using the techniques of MI, the spirit of MI, which are the ORs, yung OR abbreviation po yan. You could really see the difference between using the technique of MI versus not using the technique. Because di ba sa MI po, parang wala tayong argument na nangyayari, but actually the interaction becomes more productive without the argument and without the giving advices. So it really very helpful po. And through that technique as well, it's the client who explores the solution to his concern. You're just helping the client explore the solution to his or her concern. Though you may give some suggestions, but sabi nga ni Doc kanina, without imposing it. So yun po, it's very effective po. So I encourage everyone to really somehow get a hand on the techniques of MI.
Okay. Good. Thank you, Ivan. Anything else? Somebody raise his hand here. Okay. All right. Yes, I'm just trying to explain it to you, but you have to put it to practice, right? So obviously, Ivan has tried some of this, So we'll talk about later on techniques, no? But I want you to get grounded on this one because this is important to remember, right? Okay. The four principles are actually not complicated, right? Now I break it down to everybody understands this, right? Yeah. I just wanna, find out if there is some areas here that's not clear to you. Roll with resistance sometimes, it is not clear what that means. I try my best to actually make it very clear. I hope I achieved that. So that's why I'm asking for feedback, right? Okay. And then develop discrepancy is the most challenging part, right? That's a very challenging thing. So I don't know if people understand that well or have some questions, how that works. Or if you have tried it before and then say, oh wow, it really worked. Okay. Naalala mo rin tanong. Okay.
Yun nga po. During during our training for the interpret, interpose, rollout, some of our, one of our,
Trainers,
no,
participants.
yung hindi kasali sa aming CBT were yung mga less literated, yung mga walang masyadong pinag-aralan, hindi sila sinasama sa program, yung minors, yung may side problems. Yun nga, kasi yun nga parang hindi daw applicable. Di ba mas dapat,
I don't understand. You know,
yun nga, parang naging, hindi natin sinali sila sa program ng, because, yun nga, hindi,
okay, I understand. So they equate this technique into, you know, how educated a person is, right? Or ability to think, right? Okay. So to me, there is nothing deep about, once you understand how it works, you know, right? It's very basic, really. The one thing with MI, you know, the language is not, I mean, you know, sometimes it's like highfalutin word, oh, discrepancy. What does that mean? But once you actually understand what it is, it's not really that difficult, right? Follow. Okay, so I know. Listen, if you're a counselor, right, working with our clients in the program, and you cannot follow this, when I have actually simplified it, like I have been like skinning it different ways. You understand? I'm not just presenting it one way, I'm presenting it different ways. So you can follow, right? If you cannot follow this, right, and you're working with our residents inside, you have no business working here. It's as simple as that. Right? Really. But I'm saying is you follow it. I know you can understand what I'm talking about. Okay? What the struggle really is changing your habits. Because you have a habit of telling people what to do, right? Yeah. So I'm just changing that. A different way of working with clients. Okay? There is time for you to actually be directive to them, right? There is time for that. There is a place for that. But you cannot be always directive. Right? When they are actually doing what they're supposed to do, you don't have to be directive, right? Okay? So, yeah. A different way. You cannot, in other words, make your style, you have a variety. Not just like a one way of doing things, right? But different ways of doing. You understand? Okay, so you have, it's called a repertoire of skills. A repertoire. What is a repertoire? A repertoire is a combination. You know, right? A combination. Tools. This way. You have a basket of tools. Let's put it that way. You have a basket of tools, right? Okay. You carry that basket of tools. Depending on the situation, you kind of learn, okay, this is what I need to do. Right? If you work with these clients. You have, in other words, you have a basket of tools. If you only have one in that basket of tools, it's not gonna work. Or you're not gonna be as effective. But if you have a variety of tools in that basket, right, you'll be more effective because you can actually, depending on the situation or the client you're dealing with, you can actually choose in that basket of tools. So this is one of, again, tools that you have. Okay? The problem with this is it requires you to change your mind suddenly from let's say being directive, a pure TC, into something motivational. Okay? And you are so used to one way. You are so used to just telling the client and come down on the client very hard all the time, right? That's mostly, you know, TC people. You come down so hard all the time on clients. Okay? I'm telling you, that's not gonna work with adolescents, especially. This works also. This is gonna be very effective with adolescents. It's flexibility. It's not being rigid, right? All the time. You're flexible. Your mind is so flexible to respond to a situation, right? Okay? Not one way of doing things. We have a saying, different folks, different stroke. Diba? Same thing, different situation, different approach. Not just like one approach. Like you use it all the time the same way. It's not going to work. So if you have a different style depending on the situation, you will be able to be more effective. But that requires very flexible mind to really be able to do that. Okay? All right. Questions, comments? The reason why I'm staying on this because you are going to apply this later on. When we actually do actual role play, when we talk, okay, when we begin to put it all together and practice this, you will apply this. So, I'm trying to ground you quite well on it. I know, it takes practice. But I want you to remember this because I want you to apply it when we do role plays, not role plays, when we do the exercises. Okay? All right. Comments? No comments? Questions? Everything is clear? Yes? All right. Listen, I'm going to stop here and we'll pick it up again after lunch. What time is it? Okay. Well, it's 5 minutes to 12, right? Okay, so be back at 1 o'clock and enjoy your lunch. Okay, we can start, right? Okay. Interviewing. Interviewing. Meaning what? Between looking at. Between looking at. That's the meaning of interviewing. Looking at. Viewing, right? Okay. All right. So let's talk about Rogers' client-centered approach because it is one of the theory, that was integrated into MI. You know that, right? So he uses actually the Rogerian client-centered approach in trying to develop rapport or develop relationship with clients. Okay? So, but they added other things. Okay? So, let's look at the Rogers client-centered approach. Okay, it says congruence, genuine and authentic counselors, therapists, congruence. In other words, what you do should be consistent to what you are saying, right? The talk the talk and walk the walk. All right, so guys, you're a role. Ooh, what was that? You're a role model, right? All of us. All of us. So, congruence to me is not just like what you say and what you do here. It's also what you do and what you say even outside. It's a lifestyle thing, right? You choose to work in this field, right? And we're therapists. Look at yourself as therapists. people who would like to help other people change, right? So your life too should be congruent, your lifestyle congruent to what you are trying to achieve with clients, correct? Like this. Is it okay, right, that on your vacation, for example, you go to Boracay, okay, and say, oh, I'm actually off from my job. I'm in Boracay, this is my own time. Can you smoke marijuana while in Boracay? Why not? It's your own time. Perry? What? Ah, okay. Well, what if you do it and you don't get caught? Alright? No. You know, a lot of people get away with it. You know that, right? Okay. So, you are careful, right? You make sure that you don't get busted, right? Or you just wanna chill yourself and you brought some marijuana. What do you think about that? That's your own personal time, right? You just wanna enjoy a little bit, get a little buzz or high. Is that okay? Nico, you agree? You said, I see, I hear you like, what's going on, Nico? Okay, so I'm just saying, you're working in a TRC, right? It's your own personal time. You went on vacation to Boracay, and you smoke a little marijuana. Is there anything wrong with that? Nothing wrong, right? No? I want to hear your opinion.
It's wrong though because we are because we work at TRC and we make sure that our patient will not use illicit drugs. So,
You're not working.
no, but yes, no.
Okay, so you think it's not acceptable?
Yes, no.
It's not acceptable. Okay, who has another opinion about that? They're looking at me.
Doc, hindi rin po okay. I think as a rehab worker, Doc, I think we need to establish a personal conviction that even though no one's looking, we should still be a role model. Kahit na wala pong residents sa nakapaligid sa amin. So in that case, Doc, I think it's not okay to smoke marijuana even on our personal time. For me, Doc, personally, it's not okay. It's not okay. It's not.
All right, so how about using alcohol excessively? Huh? How about drinking alcohol excessively? What do you think about that? Is that okay? Alcohol is a drug. We don't let the clients drink alcohol, right? Okay. Drinking excessively and regularly, it's just like part of your lifestyle. Every now and then, people have a beer or a wine. I'm not talking about that. I'm talking about it is an integral part of your life. Okay? You know what I'm talking about, right? Integral part of your life. In other words, it is part of your recreational drug. Recreation. What do you think about that? Some of you have this smile in your face. I want to hear what's behind the smile. What's behind the smile? Come on, we want to hear behind the smile. What do you think? Listen up, guys.
Nag-smile lang ako, Doc, doon sa sa drinking excessively. Para sa akin, okay lang yun sa akin. Or for me, personally. Pero kasi hindi siya illegal. Yung sa drugs, hindi yun ang, kahit hindi ako nag-work dito
Okay.
sa rehab, pero alam kong illegal yun, never akong magdadrug.
Okay.
Yun lang.
But alcohol is okay.
Doc. For me only.
All right. Now I'm talking about excessive drinking, right? And then it's a regular part of your. Now I'm not talking about hey, a glass of wine or a beer while eating dinner. I'm talking about really getting drunk. That's what I'm talking about, and not like it's like a regular part of your lifestyle. And then you work in a rehab. You know what I'm talking about, right? And then you work in a rehab. What do you think about that? Yes, sir.
Doc, I think it's not really productive because we know that substance use, for example, alcohol or drugs, they can really affect our brain. And we might be, as workers, the rehabilitation, addiction kasi yung tinuturo natin, Doc. And if we are addicted to one thing, especially to the things they're also using, I think we're not really walking what we preach. Ganun, Doc. So, dapat kung ano yung in-encourage natin sila to change their ways, to change their life, then we should be also doing the same thing to ourselves. We must be the manifestation of the things that we are teaching them.
Okay, so that is congruence, right? Right? I'm talking about congruence. So, okay, so who has another opinion about that? How about you, Gilbert? Ano yung mga bisyo mo?
Okay. Marami. Self-confess, maraming mga bisyo. For as long as you don't step into another one's boundaries and you don't touch their noses, I think as long as you know your limits, yung sinabi mo kasing excessive, medyo, ano yun, Doc? Medyo ako yan. Hindi.
Okay, so let me ask you. I need an honest answer. Do you somehow think is this okay that I work in a rehab, but I have there are certain substances that I use to kind of improve my my state of mind, get high. That's actually getting high. Smoking is getting high, right? Especially
Caffeine also, Doc. Coffee is also
okay.
a substance.
I
That's
understand.
why-
I understand. Okay, it's a okay. It's right. Some substances is caffeine, but you compare caffeine to alcohol, right? Yes. Okay, and then alcohol to drugs, of course. It goes up and. I'm talking about certain things that like drinking. The way you drink. Did this ever occur to you that maybe I should not be drinking as much? Did that ever occur to you?
Yeah, it often occurs.
Okay. All right. Okay. There you go. Thank you,
But,
for,
I have supportive friends.
Gilbert. Gilbert, I appreciate you admitting that. I do sincerely. Okay. The fact that there is something in you that tells you that maybe I should look at this behavior, right? Okay, that's what I'm talking about. And isn't that the same thing that clients struggle, right, on a daily basis? That maybe I should look at my. That's what we hope for them to actually do. That they look at their drug use and realize that this is no good. Okay, I need to change this. That's exactly the same in a certain degree. It's similar, correct? And then here I am. I'm also struggling because I feel like maybe I should cut down on it, right? So if you feel that, you need to take a look at that, right? Not just I'm sorry. It looks like I really I'm on your case. But I'm just saying that you have to be consistent to what we do, right? Because that's not congruent behavior. Okay? So I'm not gonna touch the health issue, the whole thing, because that one is really a very personal thing. I'm just talking about consistency between what we expect from our residents and the way we conduct our lives, right? So, for example, me, I'm training, but ang sideline ko, I'm trafficking drugs. Right? I can't do that, right? So, I have to be somehow consistent kasi para bang it will bother me. It's a major dissonance. A major dissonance. Okay, so I'm just touching that because that's a normal issue with us working in this field. You encounter that all the time. But here is the thing with that. What if one night, right? You have drunk excessively, and there is and it started raining, right? And you're driving home, and then you had some alcohol, right? And you had an accident. God forbid, you hurt somebody badly, right? And then, when the police came and interviewed you, smelled alcohol in your breath, right? And then ask you, what do you do? And they found out you work for the tears. You see how big is a scandal that is? You will be in the front page, right? Okay. The OHTRC staff had an accident on the highway. Major one. How embarrassing is that, right? But that is a possibility that can happen. Really. So, that's, again, that's like inconsistent, right? Okay, so, anyway. So, there are certain things, unfortunately, in our work, those are some of the things that I would say, I know it intrudes to what you say. That's my personal liberty. That's my right or something like that. But there are certain things that intrudes, and it's just the nature of our work, right? This is what we do, and there are certain standards there. Like I said, you cannot just use drugs, although it's your own personal time. Just like you agree with that, right? Because you see that that's incongruent. The alcohol thing, I know that what the rationalization in that one. It is legal. It's legal, but it's still a substance, and right, it's a form of you want to feel the buzz, right? Using that substances. Anyway, it's something that's kind of we need to kind of reflect on and look at it. If we're talking about congruence, consistency, right? In what our life, our lifestyle, and what we do. Even our own personal time. Okay. All right. So that's important in that approach, that we are congruent, consistent in our behavior, right? Genuine and authentic counselor. Can you be really genuine and authentic when you know you have guilt? That's a form of guilt, right? Every time you tell your clients, you should look at your your behavior, look at your drug use, aray. Sabi mo, aray, tinamahan ako. Kasi, you know what I'm saying? Because it's inconsistent to what you're talking about. Alright, unconditional positive regard. Everybody understand what that is? What's the word they use in MI? Acceptance. That's what acceptance means also, But it is from the unconditional positive regard. Empathy, the same thing, right? Empathic listening is from this. Non-directive. Okay, so MI is not is directive at certain point. It can be directive, right? Okay, so but client-centered is purely non-directive. Reflection of feelings. We will learn that. Also, MI borrow that. Okay? Reflective listening, and we will learn reflection, different levels of reflections, okay? And then open questions. That's the first word in ORS, right? Open ended questions. Paraphrasing, a style also adopted by MI. We paraphrase, right? And then affirmation. MI also uses that. Okay? So there were a lot of things that actually the developer of MI borrowed from Rogerian client-centered. And I can see where it's coming from. Because actually Miller is a counseling psychologist from the University of New Mexico. Counseling psychologist. So he probably practiced Rogerian psychotherapy. Okay, and then integrated it into MI. Alright? Okay. Alright. This is the MI thing. Genuine, accepting, empathic. Similar, right? Assume strengths and resources within client. Collaborative. Okay, working with the clients. Egalitarian therapeutic relationship. What does egalitarian mean? Anyone? What egalitarian? What's that? What does that word mean? Egalitarian. An egalitarian society. What does that mean? Yes, equality. That's the literal meaning of that, equality. Okay, so so what this means is you are equal with your clients. You are not you're not putting yourself above the client. Okay, you are at the same level as the client. That's what that means. Egalitarian relationship. Okay, you're on an equal footing as a person, as an individual. Okay. Goal-oriented. So they're goal-oriented. So the approach is, is goal-oriented. Client determines focus and pace. Okay? Freedom of choice, medium of options. There will come a time when actually you have to present options for your clients. You do not give him one option. You give him several options. And you give him the freedom to choose which one do you think. Okay? So there will come a point where actually you can give options to a client during a counseling session. But don't give one, but give several. And ask the client to choose. So there is still an element of ownership, whatever he chooses to do. He will own that. Okay? Alright, what's goal-oriented? Counselor is a guide to help individual develop goals and the next steps. Okay, so you have the client develop this goal in treatment. Method, a way of doing something, especially a systematic way. That's what method means. We're going to be looking at methods now, right? We started with the principles. Now, what are the methods? The way of doing things. Okay, enhancing motivation to change. They say you can lead a horse to water, but you can't make him drink. But I say you can salt the oats. You understand? You understand that expression? That's true, right? You can take the horse to the water, but the horse has to drink the water. You cannot drink it with the horse. But she said you can salt the oats. What happens when you put salt on the oats? The oats is what the horse eats. Okay, you put the salt, what happens? The horse will get thirsty, correct? The horse will get thirsty. So he will eventually drink. Okay. You got it? You understand what the expression? You can salt the oats. Yeah, it's true. You cannot drink for the horse, But you can make the oats drink by salting the oats. Add salt to the oats. All right. Aha. Resolving ambivalence. Is that a prayer? A what? Oh. Okay. All right. What's the MIB of ambivalence? It's a natural phase. In the beginning, they are actually ambivalent. Okay, between changing. They know they have to do something about the problem, but they're wondering, what's the cost? What's the price? You know, what is involved? Am I willing to pay the price for the change? Okay, that goes on in their mind. Okay, so if I give up drugs, what do I have to give up? Right? What? Well, give up what I love to do, which is to get high. Give up my friends, right? Give up with the only thing that helps me cope, I have to give up that. Can I handle it without the drug? Understand? Okay, so that is what goes on in the mind of a client in the beginning. Okay, problems persist when people get stuck in ambivalence. Okay, if a client is not ready or cannot make a decision or doesn't want to make a decision, of course the client will continue what he's doing. So, he's stuck, right? Normal aspect of human nature, not pathological. Ambivalence is normal. I give you many examples. We go through that every time. You know, we have to make a major decision. Or if something happens to us that we are forced to look at, you know, what we are doing, right? So, and we need to change and do something different, ambivalence sets in. Ambivalence is key issue to resolve to change for change to occur. Okay, so you have to resolve ambivalence if you expect the person to change. Until then, it will be status quo, right? Okay, so the goal of MI is to help the client resolve his or her ambivalence. Okay, so now we are going to talk about change. How many care providers does it take to change a light bulb? Okay. Just one. Just one. But the light bulb really has to want to change. Or none. The light bulb will change itself when it's ready. None. The light bulb is not burned out. It's just lit differently. Just one, but it takes 20 visits. Alright. 3. Want to assess the need, want to change the bulb, and want to document the bulb has changed. Which one are you? Alright. Different way of looking at change. Okay? Given a choice between changing and proving that it is not necessary, most people get busy with the proof. Proof of what? That it's not necessary. Aha. An operating assumption. What is that? What is an operating assumption? People always use their best problem-solving strategies to get their needs met. Even if these strategies are dysfunctional. That's true. Look at that guy. And sometimes, you know, that's a good graphic representation of, you know, our effort or people's effort when they're trying to change and meet their needs. Their problem-solving strategy might be dysfunctional. Okay? And when it's dysfunctional, it's not gonna get anywhere. You know that, right? How change happens. Habit is habit. It's not to be flung out of the window, but coaxed downstairs a step at a time. By Mark Twain. Aha. Ooh, stages of change. Are you familiar with the stages of change? All right, so we'll go over it a little bit. So, who is familiar with the stages of change? Raise your hands. Stages and processes of change. That's what it is. Raise your hands. Dr. Jelen, Dr. Ems, who else? Ivan, Philip, Ruby, anyone else? Floro. Okay. Yun lang, yung iba, never heard of it? I'm sorry? Everybody knows stages of change? Bakit hindi nagtaas ng kamay? You actually learned that in Alright. Okay, so, but the other people, they don't know. They know? Okay. So I'm asking, okay, who has heard about stages of change? Come on. Raise your hands. Who has heard about it? Raise your hand, don't be shy. Heard of. Okay, so the rest, you never heard of it? Come on. Psychologists, all the psychologists familiar with it? Right? All the psychologists. Bakit hindi nitaas ng kamay? Gusto ko malaman. Ano tingin nyo, teacher sa akin? Natawagin ko kayo sa mag-recite? Oh my goodness. Come on, guys. No. I just want to get a sense so I can adjust the way I teach it, right? That's all I wanted to do. Come on. Alright? So I would assume that everybody knows stages of change. Is that fair? Yung iba sabi nga hindi. Bakit? Absent ka no tinuro yun? Okay, you never heard of it. Okay, so who else never heard of it? Honestly. Honestly. Okay, so there is a number of people. Okay, all right. Here we go. I'll just present it a little differently. I hope. Okay, so stages of change. In other words, change goes into, when you say stages, it's a progression, correct? It's not like one linear way. Now, hindi yung one day you wanna quit smoking, right? Quit smoking, and then one day you woke up on the right side of the bed, and you say, "Okay, I give up cigarettes." Is that really what happens? Okay. Some people would say, "Oh, just one day I realized, just one day, I just decided to quit." You hear that, right? You heard that from people? Okay. Is that really true? That, you wake up one day and you just decided to quit? Is that real? Okay, you heard it. A lot of times that's not true. Because if you analyze, okay, what are the events before he decided to change, he was already thinking about it. Thinking about it. In other words, there was already a process. He was engaged in a process of change, right? And eventually, he got to a point where he was ready to change. But he went through a process. Okay? Clients, people just decided one day, I'm gonna stop drinking. Right? But in reality, he was thinking about it already. There has been a struggle for him. I gave up eating meat when I was 19 years old. Yeah, since then I don't eat pork, beef, chicken, any meat. I eat fish, okay? Seafood, I eat that. But the meat, but there was a time in my life when I was totally, I don't eat anything including seafood. Until I was age 30, from 19. From 19 until I was 30, I did not touch meat, no seafood, nothing, okay? All right. So how did I, at the age of 19, how did I decide to actually give up all of those? Okay. Is that like one day I just woke up and I say, I don't want to eat this anymore? I'm going to say, no. Okay, looking back, I was playing that in my head. Okay, so if I give up all of this, what do I eat? What do I eat? Right? So that was the process. Okay, so what the first thing is, what can I substitute? What can I eat? The next is, am I ready to give up all of these things? You know, so it took for a while, right? You know, and I was thinking about that and over playing in my head. And this one day I said, okay, I'm ready. I just did that. One day I said, I told my mother, I'm not going to eat all this anymore. But it's not like in one day I woke up and decided to just drop that. So there was a process involved in it. That's how I did it, okay? All right, so this is what we're going to talk about, the stages of change. Hopefully we get a better understanding of how people change. The stages of change is actually developed by Prochaska and not just De Clementi, actually the three of them, Prochaska, De Clementi, and Norcross. The original research of stages of change was written by those three. And I was lucky to actually get the original research done. It was published in a magazine called American Scientist, something like that, right? So I keep the original copy of that publication. And then I read it, and I was working already in the field, right? I was doing my graduate school when I encountered it, and I said, my goodness, this explains a lot of the things that I was trying to do or I was doing. So I fell in love with the model right away because I can relate with it, okay? All right, and I'm going to tell you how you can actually use it in conjunction with MI. All right, so, okay, change, according to them, is spiral. It's not unidirectional, okay? And it comes in stages. So what are the stages of change? Pre-contemplation, contemplation, preparation, action, maintenance, termination. In the original study, there was no termination, only 5. They added that later on, okay? All right. So in the original research. All right. So some people actually put a little spin on it, okay? But those are the three, the stages. Okay, so pre-contemplation. From the word contemplation, and pre means what? Before contemplation, before thinking. Okay, literally, before thinking. Meaning, you know, the person is not even thinking about change, right? It's the farthest from his mind. And most of our clients, when they come in here, most of them are in pre-contemplation. You agree with that? They're not thinking about change. They are just here because the judge sent them. Or their parents told them to come to treatment. Threaten them, if you do not come in, you do not go in that program, I'm going to kick you out of here. You are on your own. Okay, so he's coerced. Same thing with the judge. You know, if you don't follow this, if you don't go to the TRC, you're going to prison. Okay, so that's the only motivation, if you can call it motivation. That's the only reason why they end up here. You understand pre-contemplation, right? No desire to change, no intention to change, not even thinking about change. Got it? All right. Okay, so, Relapse is viewed as a loss of motivation and movement back down the spiral of change. Okay, we'll talk about that later on. All right, contemplation. From the word contemplation, to think, right? To think. Meaning what? According to stages of change, the person is thinking of changing. Only thinking. Thinking. Right? Entertaining the possibility that he can change. That he is, maybe I can change. Maybe I can do this. Just thinking. Contemplation. Got it? Okay. So, preparation. What? Philip, what is preparation? How do you define preparation according to the model?
Doc, I think, yan yung time kung saan kino-consider niya na yung magbago. So, he's considering na magbago and wala pang action dun. Parang iniisip pa lang niya, he is considering na.
Okay. So, how is it different from contemplation though?
Parang yan yung point na meron pa rin ambivalence. Kung saan pumapasok pero hindi niya pa, not totally decided.
Okay. Okay. So, how about this? Okay. So, contemplation is thinking about changing, right? Thinking about it. Preparation is one stage higher than contemplation, right? So, how is that different from contemplation? Well, he is actually looking at options. How do I go about? Right? What can I do? Shall I go to an outpatient program? Will I contact a psychiatrist and consult a psychiatrist or psychologist, go to psychotherapy? Or shall I go to a residential program? That's part of the preparation, right? Sometimes, they look at online, let me Google, what are the options I have, right? That is part of the preparation. Studying. Okay? Studying. Same thing, when I stopped when I stopped eating meat, when I became a vegetarian, I look at options. How do I survive? Where do I get the food? I thought about that, right? What are my options? Same thing, preparation. So once the person has decided, okay, this is how I'm going to go about this, he moves up to action. Okay? Action means what? He is implementing change. Okay, so maybe in action, he has stopped. He stopped smoking, for example. Stopped drinking completely, okay? Or stopped taking drugs. Not only stop, but for a period of time already, right? He has 6 months already, he has not touched, and he continues to stay drug-free. He continues not to smoke. There got to be some time period, okay, for us to judge that the person is in action stage. You got it? Okay. So, that is action. The person is doing it already. Okay, so at what point does ambivalence get resolved? At what point at what point that ambivalence is resolved? Meaning, no more ambivalence? No. 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 What's that action? Action. You're right. It's action. No more ambivalence, action. Pre-contemplation, a lot of ambivalence. Contemplation, still ambivalent. Less, but still. Preparation, little ambivalence. Only when the person implements the change that the ambivalence is resolved. Got it? Okay, so that's important to know, right? So now, how is this helpful in counseling? If we can determine where the person is at, then we can calibrate the intervention. Got it? Okay, we'll talk about that a little bit more later. How do you do that? Okay, and how you determine. Alright? Okay, so let's talk about maintenance. Maintenance is past action, right? Meaning that the person has actually in action or has been in action for a period of time. And this is what goes in his mind. Okay, I like this. I like the fact that I'm not getting high. I like the fact that I'm drug free. How can I keep doing this? What do I need to do to maintain this? You understand? How can I keep this going? How can I prevent myself from going down, from going back? That's maintenance. And some people go attend NA, right? AA, right? Or go see a therapist because he wants to actually make sure that he doesn't relapse. He's trying to find a way to keep it going. Maybe a change of what? Friends, right? I'm going to drop all my friends. I'm going to form another relationship. Or give up my girlfriend who still continues to smoke marijuana, or my boyfriend who still continues to smoke marijuana. That is part of that maintenance. I'm trying to actually develop a different life, a different lifestyle, right? Set up some careers for me so I can, continue this process of change. That is maintenance. Okay? You understand the whole stages? All right. Okay, so I told you before that, people who eventually give up drugs or quit smoking, for example, without going into a formal treatment, they got to where they are because it involved a process. They went through a process. It's not just one day they woke up, right? Like I told you in my case, I started thinking about, what are my options? What can I, so I was in doing that process. Okay, or is this worth it? What are the benefits if I do this? Okay, what do I have to sacrifice? That I went through all over. That is the process that I went through. To a certain extent, it's similar to the processes that people use for drugs, except the processes involved in giving up substances is a little bit more complicated, okay, than giving up meat. Okay? All right, so shall we look at the processes? Where did I put it again? I got it. All right. Okay, so we'll go back to this. These are the processes of change. So the title is Stages and Processes of Change. That's what the model is called. Yes, ma'am. A what? Tapering. Preparation. Yes. He is trying to reduce, right? In a way that is action, correct? But it's not really action because he's still using. But he is doing something. Okay, it's part action, right? It's part action, but it's not action yet. But he's doing something about it. Okay? You only decided action said is complete cessation of drug use. Okay. All right. Consciousness raising. What does that mean? Getting more information. Learning more about, okay, what is involved in this change? Okay. Okay, getting information. That's what it is, consciousness raising. Consciousness raising. Becoming more aware about what would it take for you to change. Okay, and a lot of times, like people want to learn more about, giving up drugs. Okay, so, or learning more about the consequences if he continues to use drugs. Okay, what would be, what would be the final outcome? What are the long-term effects of drugs if I continue to use drugs? That's consciousness raising. Counter conditioning. What is counter conditioning? doing something, an alternative behavior, okay? Opposite from what is actually you're doing, okay? Like, finding an alternative, for example. Maybe jogging, running, or something like that, okay? All right. So, dramatic relief. Okay, seeking ways to act, basically exploring feelings around your drug use, for example. Okay. Counseling, seeking counseling, or talking to somebody, or realizing, emotionally what the toll of this drug is. So it deals with some of the feelings involved, in the problem behavior. Okay, how I'm impacting my, what kind of feelings I'm causing. Maybe I'm causing grief. Okay, or experiencing grief for giving up substances. Yeah, or if you lost somebody, just experiencing that grief process. That's in dramatic relief. We're talking about the loss. It's dramatic relief. Okay, so environmental reevaluation. What are my impact? What are the impact, the environmental impact of my drug use? Who are the people around me that's affected by my drug use? Okay, how does this impact my family life? How does my drug use affects the people and things around me? That's environmental reevaluation. Helping relationships, going to finding a sponsor, for example, okay, or a positive friend, a friend who doesn't use drugs, right? Okay, so that would be helping relationships, utilizing them as support system, your friends who are positive, or people who are positive in your life, and using them as a support system. Reinforcement management. What is reinforcing for you? Reinforcing for you. Okay, it works like this, right? Rewarding yourself. For example, for a positive thing that you did. Okay? Let's say, you achieve 90 days of sobriety, right? You want to reward yourself for doing that, right? So you come up with something to celebrate that, for example. You call a friend who is positive and say, hey, listen, let's get out. This is my 90 days. Yeah, you reinforce. Okay, it doesn't mean that that's an excuse for you to buy a Rolex because you have 90, or right, splurge and shopping, right? Because you actually have 90 days now. I'm not talking about it. It's a small reward. This is how it works, guys. Listen to me. Okay? You want to use this because this is very effective in shaping behavior. Let's say, you struggle with reviewing for your class, for your exam. Okay? So you do it like this. You think like, if I finish my review, right? I finish my review, I'm going to reward myself. I'm going to party or whatever, okay? Reward yourself. It's okay. You finish the review, right? Because you're thinking, okay, after the review, I'm going to reward myself. Come up with any reward, okay? That is actually reasonable. Now, do not do it this way. I'm going to actually celebrate because after my celebration, I'm going to review for my exam. Okay? You reverse the process. You reward yourself first before you do the tasks. Okay, reward muna bago yung tasks. Okay. What's gonna happen? You guess what's gonna happen when you do that? You end up not doing the tasks. You end up not doing the tasks. So, that's setting up, that's reinforcement management. Okay? So, in little things in life, try that. And you find yourself being very effective all the time. reward yourself after the task, after you complete the task. That is good. It will actually get you to repeat the process, but not the other way around. Remember that, right? The other way around is the addict's way. Yeah, they always want the reward first, right? Reward first. And little kids, right? They want to be rewarded first before do the action. No, even your children, you don't do that. You tell them, okay, if you finish the task that I gave you, we'll talk about it. Okay, but do it first. That's the way you do it, and then that's an impact. It's likely to repeat that positive behavior. Okay, what is self-liberation? What do you remember about self-liberation? You studied this, right? What is self-liberation? According to this, it's a process, right? Okay, Nico, what is self-liberation according to this model? Oh.
From addiction, we liberate ourselves from.
How? What does that mean? Oh, give it a shot.
When you free yourself from your thoughts or from your yung parang nag-out ka of your personality. So that's self-liberating. Kasi hindi pa ako nag-out about my sexuality like that. That's self-liberating.
Accepting your... Well, that's very enlightening. Okay. So it's called egosyntonic. Egosyntonic, right? And there's such thing as ego dystonic. Do you know that? Okay. So egosyntonic homosexuality. You talk about that, right? Is that what you're talking about? Being gay? Okay. So an egosyntonic homosexuality is you actually accepted that that's who you are. And you don't care about what people think, but this is me. That's syntonic. But there is also homosexuality that they struggle with it. Okay? And they are not ready to actually accept that they are gay. That's ego dystonic. Okay? So you are, what you're saying is you're egosyntonic and you're liberated from the burden of trying to hide it, right? Okay. Yeah, it's similar to that. Self-liberation. You know, that you can change. Taking personal action or taking responsibility for your problem, right? You admit that you have a problem, that you need it to change, and that you can actually take a personal responsibility for it, and you can do it. Okay. All right, that's self-liberation. Thank you for that enlightenment, Gilbert. That's a good way of explaining it. Are you pulling my leg? Okay, then you are ego-dystonic. You're ego-dystonic. All right, self-re-evaluation. What? Looking at yourself, you know, and then is this acceptable for me? You know, can I continue to do this? All right, right? Self-evaluation. You're looking at what's going on in your life, you know, assessing, you know, where do I stand with this right now? Do I accept that I have a problem? Okay. All right. So that's self-evaluation. Social liberation. Looking at society and finding means to support actually your recovery. Like, again, going to an AA meeting, for example. You volunteer to a club, for example. Okay, finding community resources. Maybe there is some counseling resources in the community that you could use. That is social liberation. Or going out and making lectures or speaking engagement. Okay? Speaking engagement to help you in your recovery. Some people feel like if I share my efforts, my my journey to other people about my recovery, that somehow it's helping me also at the same time. That is social liberation. And then stimulus control is basically making sure that there is nothing in your environment. Okay, making sure that nothing in your environment is a trigger in your drug use. A good example of that is if you are trying to quit drinking, for example, right? And somebody lives at home who also is a drinker, right? And he puts all his beer in the refrigerator. It's the same refrigerator you use. Okay? What happens? Every time you open that refrigerator, San Miguel says, hello. Okay, right? Not good, right? Because what if one day you just pull that San Miguel, right? And you end up drinking again. So stimulus control is cleaning up your environment. So there is nothing in your environment that can actually cause you to trigger the use drug. So you can tell your friend, please do not put that beer in there. Or you can have your own refrigerator or cooler and you put your own drinks there. So you don't have to be exposed on that thing. Or giving up, not avoiding places where you normally go to drink or to get high, right? Okay, yeah. So really, basically, avoiding triggers from your environment. That's stimulus control. Okay, those are the processes, and clients go through this process to move in the stages of change. So there are some of these processes that belongs to pre-contemplation. Okay, there are some processes here that belongs to the higher stages of change. Okay, but all clients go through this to move in the stages. You got it? Okay, so let's look at this again. Okay, so the thing with this is, it's not like you go one cycle and you're done. That's not always the case. Some people go up there, reaches the highest stage, or maybe action stage, and then relapse. Okay, so people can relapse. Or some people get stuck in some of the states. Okay, these are people who cannot resolve their ambivalence. Okay, they reached preparation, but then all of a sudden he lost his interest, and back again to pre-contemplation or contemplation. Okay, so people recycle in this, maybe a few times, but what they found out is when people reach a certain stage of change and then they relapse, they can recycle back to that stage faster this time. In other words, what you learn in the process of recovery, you can use. You don't, just because you relapse, it doesn't mean that everything that you learn is out the window. No. It's still there. Okay? It's still there. It's an interesting thing to observe that some people who actually left treatment before completion, some of them were able to stay drug-free. We found that out from our program, from there. Okay, some residents, they did not finish the program for one reason or another. They just decided to leave. And then find out later on that they were able to continue their school, finish college, and found a job. This guy never finished the program. What does that mean? That he learned something from the program. And you use that learning to help him actually achieve those things. So if clients left the program, relapse, it doesn't mean that he completely forgot what he learned in the program. Okay, and he's gonna use that, hopefully use that when he comes back to treatment. I think you have somebody who just actually came in, right? Who came back, who was in your program before, right? Yeah, it happens, right? Okay, they return. Did you notice did you notice them adjusting to the program quicker than other people? Do they respond? Do they adjust to the program faster? Yeah. So there is no need really to keep them longer in EMU. Okay, guys, listen. I would not keep them longer there. If he can actually show me that he can adjust to the program faster. He adjusts to the program, he's back to the routine, he's doing what is expected of him, I would just move him to the regular program. I would rather keep him longer in the regular program. Because what can he learn in EMU? Not much, right? So you need to put him back faster so he had a longer time in treatment. Longer time. He needed that. Also, it doesn't mean that he did not remember things that he learned in the program. Okay? So probably he just needed more. That's why he relapsed. He came back and hopefully, he can learn more. And next time around, he has more skills to stay drug-free. Okay, so that's the way it goes. People recycle, right? It's not like a straightforward thing. Okay, so here it says, relapse is viewed as a loss of motivation and movement back down the spiral of change. And then that he can actually pick himself up and go back and do the process again. And go through the stages. Alright. How is this helpful in counseling? Do you think? Let's say learning the stages, right? How is this helpful in managing your client or in counseling? Yes, Ivan.
As you mentioned earlier, Doc, knowing the stages could actually help you recalibrate your intervention to the client. For instance, if you know that the client is yet in the pre-contemplation stage, then you know what kind of techniques you are going to use with the client. For instance, pre-contemplation, it's not going to be the self-liberation, but instead consciousness rising. So you know what techniques to do if you know where the stage is the client at.
All right. You're a good student. You pay attention, Ivan. Yes, exactly. It's about the way we talk to the client. Okay, first is you have to find out where is the client in the stages of change, right? So many of our clients, you don't even have to think, many of them in pre-contemplation, right? Every now and then you encounter somebody that, makes you think that he's probably in contemplation. He's thinking, he tells you like, hey, before I came in here, before I got arrested, I was actually thinking about maybe I should do something different. That's contemplation. So he got to that stage. Anyway, so pre-contemplation, right? That's many of our clients in pre-contemplation. So if a person is in pre-contemplation with regards to changing or giving up drugs, so what might be your approach? How do you talk? This is like some people say, he just look at me. He doesn't say anything, right? Right? He won't give me anything. He doesn't talk, right? Okay. Remember what I said when your client is like that? Don't talk about anything heavy. Try to find out what interests him or what are what he likes. Very simple, right? Find out what it is that he loves. Biking, mountain climbing, whatever. Okay, besides using drugs. Okay? movies, music, sports, right? Or even talk about the weather. Come on, right? If anything else, if anything fails, talk about the weather. Oh, it's so hot. All right. You know what I'm saying? Keep it simple. Pre-contemplation. All right. So, but how is that a counseling thing? That's not counseling. Well, what you're trying to do is engage the client, correct? That's what you're trying to do, engage the client. So you cannot engage him by actually telling him, do you know you have to stop using drugs? That's not a good way to start. He's in pre-contemplation. Oh, wow. Do you know about AA? No. He's not ready to hear that, right? Yeah. So, keep it simple. Sport is a good way to break into clients. The other thing, is what do you like in school? What's your favorite subject? What are you good at in school? And some people would light up and say, oh, I'm good in math. Oh, really? You're good in math. Why do you like math? Right? Start talking about that. What awards? Did you get any awards in math in school? And then if you hit that right, and he says, yes, I was like this, like that. And you keep talking to him, tell me about it. And before you know it, his defenses is down, he's engaged, and talking about mathematics, right? What do you want to finish in school? Okay. What's your dream? What you really want to accomplish? Since you are very good in math. And then he'll tell you that too. Right? Oh, really? I want to be an engineer. Or I want to work in IT. I want to be a programmer. And you know what? Between you and me, I want to be a hacker. No, not that. All right. Okay, so keep it interesting, right? So you hit on a good thing and stay there. Stay there until he warms up with you and and he finds the session very pleasant, right? Because he was able to share it to you and you're very attentive and you appreciated it, you get excited about it, right? Yeah, that's a beginning, right? So you stay there until he's ready to move on, okay? And before you know it, he's gonna tell you. Or you can actually trigger something and say, that's wonderful, you're very good in math. I just wonder what happened in school. Can you tell me a little bit about what happened? I'm not very good in math myself, so I really admire you. You're very good in math. Tell me what happened in school, since you're very, right? And then, you start from there, and before you know it, he's telling you, he was getting high. That's why he dropped out in school. He happened to meet some friends, and this friend introduced him to drugs, and one thing led to another. And you just started talking about he loves mathematics, right? You steer him after a while by asking questions. What happened to that? Since you're very good in math. And if he's already comfortable with you, he's going to tell you the whole story. Right? And then after the session, he feels good and say, "Whoa, I was able to talk to my counselor. He appreciated my talent in mathematics." Okay? And then a relationship is formed. It can start anywhere. Or you can be talking about basketball. Say, "Oh, basketball. Who's your favorite player? Which team? Right? Why do you like that guy?" And then, also like basketball. Did you watch? Did you see that game? And then I said, "Did you play basketball in school?" I'm going there. I'm going there. He doesn't know. Okay. Did you play in school? Oh yeah. I played in school. Right? What was your position in school when you were playing? Kennedy, start telling you, and what are you good at? What part of basketball you really like? What are you good at? Okay, outside shooting, I'm very good at that. Oh, what's your average score? And then, did you play in school? Yeah. And then I would ask, so what happened with that? Tell me, what happened with that? And you're leading him, right? You know what happened. Well, the fact that he's here and not playing basketball, something happened, right? Okay, so in other words, that's not like a useless talk. In your mind, you have some goals for him, and eventually to talk about what happened to him. Okay, so that's the way you handle pre-contemplation. You got the idea? Okay, so do not talk about heavy stuff in pre-contemplation. Keep it simple. Find ways that you can actually talk about, right? Get him excited to talk about those things that he is good at. Okay, and and find a way to relate that to what happened to that, right? And before you know it, he'll be talking about how he ended up in the program. Does that make sense? Does that make sense? Yeah? Okay. So, that's the way you handle pre-contemplation. So, some of you told me, oh, but he will not say anything. He just sits there. Find a way. Find what interests him. Find what excites him. There got to be something that excites him, correct? Got to be. Alright? Find that. Alright, so you got it then. Contemplation. These are clients who would tell you, I tried something. I tried giving up drugs. Right? Have you heard that? So I would say, wow, really? So how many days? How many days? Not like, how long? How long were you drug free? That's not a good question. How many days? Keep it simple. So if he says, oh, only 1 week, don't say only. 1 week is a long time. Make a big deal of that. Right? Although it's just 1 week, just make a big deal of that. You know, some people can even stop for a few hours. But you did it for 1 week? That is amazing. Okay. How many times did you do that? How many times did you attempt doing that? Right? I actually tried it twice. Twice, really? So what happens the next time? How many days were you able? Okay, pre-contemplation, right? And then try to explore that. Okay, what made you think about stopping? Explore that, right? What made you stop? And how did you feel when you were not using drugs? What was different when you were not using drugs? You follow what I'm saying? Right? And he'll give you a lot of, tell me more about that. You know, hey, I got along with my parents better when I was getting, really? Okay, so what was different when you were not using that? What was going on? What's different in your relationship with your parents? Explore that with him. And as he talks about that, he begins to realize, wow, shit, I really, sorry for the French. Sorry, I use that for punctuation, okay? Okay. All right, so then, explore that with, with him and say, wow. So you got along with your parents when you were not using, and when he's telling you that, he's getting some insight. Wow, I did not think about that, but you are right. I was getting along better with my parents. I'm able to communicate with them better, right? My parents was happy, and I was happy. During those times, you're getting somewhere there. You're moving him to preparation, actually. Before you know it, he's actually thinking about, I wish I could repeat that. But I keep failing. I tried it twice, but I wasn't able to sustain it. Explore that as well. What happened? What do you need? What do you think, was missing in that? What do you think went wrong? Right? How did you feel when you failed? That's right. So you're exploring feelings, you're just listening, right? You're trying to get more from him. You're not forcing him, right? You're just trying to get more. And the more he tells you, the more he talks, things get clearer in his head. Things get clearer in his head, right? You got it? And then, before you know it, you're able to move him up onto action, and then he says, I really need to do this. That's what you want to achieve. I really need to do this. Can you move a person from pre-contemplation to action in one sitting? Is it possible? Is that possible? Yeah? Moving a person from pre-contemplation to action in one sitting. It's possible. It's possible, okay? But do not shoot for that, guys. Don't be too ambitious, okay? Don't be too ambitious. But it is possible. Probably once you actually master MI and you understand how to determine where the client is at in the stages of change, you probably could do that. Okay? But in the beginning, just modest progress is okay. Even if you did not move the client from pre-contemplation to contemplation, but you were able to engage the client, take this as an achievement. Okay? Do not rush the client. Stay with him. Same pace. Okay? So if that is your strategy, it doesn't seem very complicated, right? It simplifies our job, our tasks. Because we have a clear cut, we have a clear way. Rather than like fumbling all over the place. Talking and it says you wonder yourself, where is this going? Where am I going with this? Right? I don't know. Right? Here, it's very clear. Client, is in pre-contemplation. You want to move into contemplation. Help him move to contemplation. Okay. Questions? Comments about the stages of change? It's an excellent tool, isn't it? When I first encountered this, that's exactly what was in my mind. I said, oh my God, I was doing some of this already. True, I was doing some of this already. I just didn't know it was stages of change. That's how I start with a client anyway. I talk about almost like if somebody is watching, if my boss is watching me, he's probably saying, what the hell is he doing there? Talking about these things. But I had a clear idea what I want to achieve. Okay? Trust me. You do it that way, it never fails. It might take a few sessions before somebody can begin to talk to you, but it's okay. One little step at a time. Okay? Alright, questions? Who can relate to what I'm saying? Come on, I need some positive reinforcement. Come on, guys. Validate me, please. Validate me. Ivan. Akala ko nagtaas ka ng kamay. Oh, okay. Okay. I said, validate me. Come on, tell me some stories about your experience with regards to this. You have nothing to say? Come on. You've been working here for a long time. Yes, Romel.
Sir, you started to avoid eating meat. What stage of change are you in right now?
I'm in action. I don't miss it. Nothing. I started eating seafood, remember? And the other reason why I did that when I was doing a lot of traveling. When I started working overseas. Okay? When I worked in Thailand, right? I told you for 2 years I worked there and I started a program, I started a TC there. It was tough because, I was traveling and people took me to travel. People were helping me with the work. And then, a host would feed me And then there's nothing I could eat because everything there has meat, right? And I wasn't eating seafood at the time. I ended up just getting some rice and reaching out for the soy sauce. They look at me, what's wrong with this guy? And then I would just like put soy sauce and I was eating rice and soy sauce. And it's like a lot of food in front of me. And they were like, they look at me like I was nuts. What's wrong with this guy? Maybe he needs rehab or something. But,
So, Doc, wala pa kayo sa maintenance phase.
no, nasa maintenance na ako.
Sa maintenance phase.
Yeah, yeah. I was clear. Seeing meat doesn't stress me. I was sure this is what I wanted to do. Okay, so anyway, the story there is so funny, right? And then the bishop who was taking me around pulled me aside and say, it says, what can we offer you? He asked me, what can we offer you? I didn't tell him that I don't eat meat to begin with. I did not explain to him. Because my philosophy at that time, listen guys, my philosophy at that time when I decided to stop eating meat, whatever comes my way, right, for meals, and what I can eat, I will eat. That's it. If it's just like rice and soy sauce, I will eat that. And I'm fine with that. He doesn't understand that, right, the rest. So he pulled me aside and asked me, our host is like wondering what he can feed you. So I started thinking, I said, geez, I don't want to impose on these people. Right? I don't want to impose on them. So they have a lot of fish, they have a lot of seafood, right? So I said, okay. I said, okay, I'll start eating fish and seafood. That's the only time. That's the why I ended up eating. And then after that, I still continued to travel when I was in the US, and it was just easier for me after that. So I started eating seafood. But once I made that decision, I never relapsed. I never tried. I never ate it again. So I know, I am comfortable with that decision. I know some people are, yeah, you're not tempted to eat like lechon or something like that. So I'm past that already. I told them, It says we are eating meat and we are enjoying our food. Don't you feel like I said tempted? He said no. I said you can enjoy whatever you want to eat. Don't mind me. I said I will eat what I want to eat. That's been my philosophy. So after I started eating fish, there was not much question because there's always fish. In fact, between the Filipino cuisine and Thais, the Thais have more things I could eat than Filipino. You know why? Filipinos love to put meat in everything. Kulang na lang lagyan ng giniling yung champurado. That's my complaint about Filipino food. Don't you find like everything has to have meat? The Thais are not like that. Sometimes they have actually vegetable dish too. Or they have just vegetables. Fry it. Or the Chinese, like yung kangkong, gisa lang nila, right? Okay. Morning Glory, I love that. Morning Glory is garlic. Okay. We have to put giniling on it. Okay. Right? So it's tougher here, actually, when I did not eat seafood. It's tougher here than actually in other places. Anyway, so that was my story with Thailand and how I ended up eating seafood. But I was a complete vegetarian for many years too. Okay, probably it's hard to relate to that, right? Because you guys love meat. I don't miss it. Not at all. Okay. Question, comments, validation, come on. Your experience in working with clients, share it. Right? Can you relate to this? What I said? That's what I want to hear. Did you try it before? Okay. So you went to training, some of you, interpret. What happened? Did you put that to practice? That's what I want to hear. If you put it to practice, how did it help you? What was different when you started implementing stages of change in your counseling? That's what I want to hear. I want to learn from you too. And nobody wants to share? Come on. Anyone? Who are caseload managers? Caseload managers. Caseload. Oh, wala na. Nagtago na. Caseload managers. Caseload. Okay, caseload. All right. Tell me some stories about your work with your clients and stages of change. Come on. Is that a secret or something? So, how do you work with your clients? Relate it with this.
Pwede pong, hindi siguro sa stages of change, but then, yung experience ko po dito is, nakaka-relate po ako dito sa mga tinuturo ni Doc kasi I once in a psychiatric facility. I've been in a psychiatric facility for almost 4 years. I dealt with different clients with different psychiatric conditions. And ang ganda po na ma-exercise mo yung kung paano ka mag-counsel, kung paano ka mag-establish ng good interpersonal relationship or rapport with clients. And I was once a resident in a DSWD setting wherein I was with abuse victims, rape victims ng mga adolescent. Meron 3 buildings somewhere in Leyte. Yung isang building, home for girls, wherein andun yung mga rape victims. Tapos yung isang building doon sa building namin, regional haven for women, wherein kasama ko doon yung mga rape victims din pero mga pregnant. But hindi ko rin po inaasahan na napunta ako sa ganitong situation, ganong area. Kasi pagpasok ko pa lang talaga makita mo na, grabe, bakit andito ako sa area na to? But then, what I learned, in everything, give thanks. Maganda man ang nangyayari sa'yo, maganda man o hindi ang nangyayari sa buhay mo, magpasalamat ka pa rin sa Diyos. Sapagkat siya lamang nakakalam ng pinakabuti para sa'yo. Yung nangyari po doon sa area na yon, I was with the abuse victims, yung mga ladies po doon talagang rape victims. Naging ako doon, I was a nurse that time already. I have my kids with me, solo mother po ako. Yung nangyari po doon, I was a silent motivator, hindi po ako masyadong nagsasalita, but then nakita ng mga clients na kung paano ako magtrabaho din. Yung mga rape victims doon, after kasi ng mga anak sila, nilalagan nila yung mga bata doon sa isang RCY wherein adoption po yung mga bata for adoption. Yung nangyari po doon, I was with them at halos araw-araw nag-aawa yung mga kasama kong mga victims ganun. Yung napansin nila being silent motivator, sabi nila sa akin noon, bakit ate, bakit kayong lahat nandito, parang ikaw lang hindi pag-away, sabi nila. Sabi ko, bakit ko naman kasi kayo aawayin? Tapos, yun, naging referee ako doon ng mga nag-aaway araw-araw. But then, the good thing is, yung pagiging counselor ko, yung pag-counsel ko sa kanila, parang, kumbaga, yung ginawa ko kasi is parang, I am attending discipleship trainings, mga ganun po. At meron po ako mga natutunan ng mga biblical way of kung paano mo siya i-share, yung mga biblical ideas or biblical learnings na pwede mong i-share sa mga clients. Na-implement ko pa yon at nakita ko pa yung result nun. At in the end, yung mga clients po na yun, yung mga victims, hindi nila nilagay yung mga anak nila sa adoption area. kundi kinip nila yung mga bata nung during their discharge. Yun po. At nakita ko na magandang way yun na kung meron kang gustong i-share sa iba na pwede makatulong sa kanila, pwede nilang ma-carry yun at maipakita nila into action. Yun. Tapos, dito po sa Isabela, hindi po ako taga rito. I'm from Ilocos Norte. But then, andito po ako. I know my calling. I had a lot of traumatic events in my life. But then, nung pag-stay ko dito sa Isabela, hindi ko na-expect na I will be dealing with yung mga lalaking mga clients. And I had this traumatic event na iniwan ako ng partner ko. Yun, at parang hindi ko matanggap yun. Naging malaking ano yun sa akin na bakit ako iniwan, parang ganun. Then, I am a nurse here at TRC. Yung nag-experience ko pa dito, as a nurse, nung nasa EMU pa lang yung mga clients, and then yung pag-care, be empathetic to them. Andun yung pag-care, andun yung talagang hindi mo sila ginajudge at dapat naiintindihan mo yung kanilang mga sides at yun, as a nurse, yung pag-deal mo sa kanila is yun, while taking vital signs, mga ganun, andun yung extract yung care na kung paano mo sila i-treat bilang tao at hindi mo sila ginajudge. Nakita ko yung effect niya doon na you are building trust. Yun, successful yung trust. At sa mga lectures, ini-incorporate ko po aside from health educating them, ini-impart ko yung mga, ang dami namin na pag-uusapan kasi kung makita mo yung clients mo, ano yung mga kailangan nila, kung sino sila, marami kang pwedeng i-impart sa kanila. At nakita ko doon na may impact yung mga lecture kasi during discharge, sasabihin ng mga clients or during my first lecture with them, yung sanabi ng isang expediter dati na bata, pinuntahan niya ako, sabi niya is, ate, sa lahat ng mga naglo-lecture sa amin, ang gaan-gaan ng loob namin na makinig ng ganong klaseng lecture. May impact, tapos pag nadi-discharge na sila, sinasabi nila na, bakit hindi mo na tinuloy yung mga lectures mo sa amin? Mayroon akong nakita doon na parang effective siya. Doon sa mga nagawa ko, although, meron akong pinaglalabanan na weakness ko din on my part. Kasi, the thing is, may mga nanliligaw. Ganun po, it's realistic. At yun ang dapat paglabanan. Kaya hindi ganun kadali na maging counselor din kasi kailangan mong paglabanan din kung ano yung mga weaknesses mo. At yun ang gusto kong ma-overcome. Kung ano man yung mga weaknesses ko or yung mga nangyari sa buhay ko, pwedeng yun yung gamitin natin na way, yung mga hindi magandang nangyari sa buhay mo, pwede mong i-share gamitin mo itong way para sa mga ganitong, merong ganitong pinagdaanan maging blessing para sa kanila. Yan po. At sobrang nagpapasalamat ako kasi, and I think that, yun na, itong mga nakukuha po namin sa inyo, very thankful po ako kasi ang ganda po ng mga natututunan kasi, yun nga, I want to become an effective counselor.
All right. Thank you for sharing that. Thanks. Okay. All right. How about the doctors? When you work with your clients, can you use this?
Doc, may tanong lang. Ito po ba is
Doktor ka na pala, no?
Ay, hindi po, magtatanong lang po.
Okay, King.
Nag-a-apply din po ba to pag ang motivation ng patient is external?
Good question. See? Pwede ka na maging doctor.
Yes, Doc.
From external to internal, right? External motivation, internal motivation. Yeah, you can work on that. Yeah. And then the idea is for them to actually realize that what brought them here is external motivation, right? So you transition from there. I says, but is that enough? Sapat na ba yun para ikaw makapagbago? Paano kung wala na yung order nandiyan sa'yo? just imagine, pag wala na yung order na jet sa'yo, what would keep you from staying in the program and staying drug free? So you try to move him from external motivation to, okay, what would motivate you? What would be your reason for staying here or for staying drug free? Diba? All right. So yeah, you can start anywhere. You accept the question and then just work with that, and then try to move that person to wherever you think he should be. Right? Okay. Thank you. So, Dr. Jelen, can you use this in working with clients with medical problems or something?
Actually, Doc, based from kasi nagle-lecture din po kami sa mga DOH accredited physician. So, based from what I've lectured po, you can make use of MI sa brief intervention. Like, for example, if you knew that the patient is already using alcohol or nicotine, from there, you could now initiate po yung conversation of MI po. So, yun po yun na impart ko rin doon sa aking mga kasamahan. So, I guess okay po yun. And then, kasi nasanay po kami as doctors na we give more of advice. So, yung pong MI na na-introduce po sa amin through CBT, yun po, pwede po talaga siya magamit. Yun lang po.
Okay. Good. Anyone else wants to share? I want to hear your counseling experience. That's what I'm really wanting to. All right, Ivan.
Sa amin po kasi, Doc, referral based po sa psychologist. Yung main caseload managers namin are social workers. So, yung process po namin, if pag hindi na po nila kaya i-handle si patient, both the program people and the case managers, i-refer sa site. So, once they are referred to me, parang parang nandyan sila sa contemplation stage. Contemplation. So, parang nandun na sana sila sa action, and something happened inside, and then the patient go back to contemplation. So since I'm aware na nasa contemplation stage sa kaagad, so, at that time, so what I do is that, ano ko po, so bali may ambivalence po whether to continue changing or not. So parang pinipresent ko po sa kanya yung mga possibilities of changing or continuing the demotivation, parang ganun po. And then, I use the MI techniques, the spirit of the MI, yung mga yung no argument, no suggestion, all those things, wala. Kung nakikipag-argue si patient sa akin na galit siya dun sa isang staff kasi ganito, ayoko na kasi ganito, ganyan. I don't argue. I just present the possibilities na siya rin din na mag-explore ng mga possibilities na yun and slowly transition into preparation. And then pagdating sa preparation, mag-explore kami ng dalawa. So, sa ano kaya pwede natin gawin? Ano kaya ang technique na gawin natin para hindi mangyari ulit yun? And then, the client suggests. So, we also explore yung kakayahan niya na to implement yung sinasabi niya na gagawin niya na measure to intervene yung mga experiences niya sa loob. So, malaki din ang chance na nagagawa niya kasi siya din mismo ang nagsasuggest ng mga sinabi niya. Yun po.
Okay. Good. So, you help him develop ownership, doon sa action. So, okay, so we was talking about how do you determine, how motivated or how committed a person. You know those from the scaling questions? In a scale of 1 to 10, you know how to do that? Where 0 means this and 10 means that. Where are you at in this? Are you familiar with that? That's a cool tool, right? Okay, we'll talk about that. Hopefully we get to that point before I finish the MI. We'll have MI tomorrow also, so we have actually 2 days to do this. So, okay, so we'll learn that. Scaling question. Yes, Romel.
Doc, since around 90% ng patients namin sa residential are plea bargainers or court mandated. So they've been in jail for a year, iba 2 years na. So they haven't been taking any drugs
Substances.
anymore. So, what stage of change will they be at?
Good question. Okay, good question, right? All right. So, in their particular case, actually, their abstinence from drugs is more self. It's imposed by the environment, correct? Okay. So it gets a little tough to find out where are these people at, right? So you can explore, where are they at with substances. So, okay, so you ask questions like, okay, so you have been drug free, right? You have not used drugs for what, 2 years. Okay, so how do you feel about that? No, how do you feel about that? And although it's gonna be tough for him to say, yeah, I still want to take drugs, because he's thinking like, you're assessing him, and if he tells you he's gonna use drugs, that might actually, he's thinking that you might keep him longer in the program. So that's, you have to consider that, right? That he might not be totally honest about his position about drugs. That makes it very tough to determine where they are at with regards to using drugs. Okay? But you can still explore that with a client. How do you feel that? So what's different when you were not using drugs? You can explore. Not, we don't know where he's at in that stages, right? What we can judge him is how is he responding to the program. We can use that also, and relate that to, hey, let's say this client is still having a problem here, adjusting to the program. Okay, so you have not used drugs for 2 years, and yet you're struggling with the program. Help me understand that. Tell me about that, right? So if you are not using, but you're having some problems with the program, which should be helping you actually, in my mind, it should be like his attitude would be, oh, this is good because that will help me stay drug free. But ask him, what's the problem? Why are you struggling in the program? That might reveal to you a little bit about where his mind at. Okay, so you can say, like, put a bait in there and say, most people who resist the program are people that are ready to give up drugs. But that's not your case. That's not your case. You already stopped using drugs, right? But, and still you struggle with the program. Most people who have a problem with this program is because they're not ready to quit using drugs. But you have been drug free. Right? You're presenting to him the discrepancy between him being drug free and him having a problem coping with the program. Okay? So, and see if you can get something out of that. If he gives you something. Alright, so you just have to think of ways to pull that out from him. But it's hard to judge. And it's hard to judge where he's at with regards to actually drugs. But you can talk about other things, with the stages of change. Adjustment with the program could be another one. Where are you at in this adjusting or accepting the program? Where are you at with this? How do you feel about this program? Do you really accept this program? Ask this kind of question and see how much you can get from a person. Right? So, yeah. Do you, that's an excellent question by Dr. Rommel. Do you encounter that? You don't know where the person is at, right? Do you have those clients who have been actually drug free? Hopefully they're really drug free, right? I don't know really if, maybe they're saying I'm drug free, but actually because some people have access to drugs in prison, so that's not 100% guarantee that he was not using drugs in prison, because some people are able to continue to use. All right, so that's another thing. How honest is he with regards to drug abuse? So you want to explore that, okay, and explore the fact that he's, assuming that he's not using drugs. Yeah, it's tough. Okay, so but nobody's talking about that. Hey, it's hard for me to determine a client because I don't know his drug status before he came in. He's not being honest about it, right? Yeah. So, and reconciling or trying to understand why would they be resisting the program when they have been drug free, right? What's the issue? What's the problem? All right. Questions, comments before we take a break? Floro, questions? What do you think about stages of change? Are you able to use this? Because you told us about, looking at the person, understanding a little bit deeper. How do you use this, when you're trying to work with a client?
Yes, Doc. In fact, I've been a practitioner of behavior change communication long before, and we've been using stages of change along with the phases of counseling. So, in the phases of counseling, when you are going to assess the client, you will know what stage of on what stage the client is in the stages of change. So that way you will know what to intervene or where to intervene in these stages and what information to provide.
In that model, what do you use to determine the stage of change?
Ito po,
So
discuss. In the behavior change communication, yun ang ginagamit namin. At the same time, along with the phases of counseling, in that process, in the phases of counseling, we will be able to determine on what stage they are in when we use the phases of counseling. Pag nasa Hello. Ang ginagamit namin, Doc, yung gather approach, greet, assess, tell, help, explain, and refer. Yun yung sa ginagamit namin noon. Tapos yung sa in-introduce namin ng USAID saka Johns Hopkins. Yun yung establishing, rebuilding rapport, assess, provide information and options, and then explain and refer. Yun yung ang ginagamit namin in relation with the use of stages of change.
with the use of that, you can determine the stage of change.
Yes, Doc.
Okay. All right. So I'm not familiar with the stages of counseling. So I don't know how that we can actually use it with to determine the stages of change, because it's tough to actually determine that unless you actually work with a client. This is I made it clear, right? You can determine where the client is at using this, right? You don't have to use any other assessment by just talking to the client, right? Very simple. Pre-contemplation, there is zero desire to change. Only to keep the status quo the way it is, no change, right? Okay, simple, right? Pre-contemplation, some thoughts. He would say, it crossed my mind before, or I thought about that. I thought about changing that. I found it challenging. I'm not ready to do anything, but I think about that. That's pre-contemplation, right? Even though it's just a thought, but if it occurred in his mind that he needed to take a look at his values, that's pre-contemplation. Preparation, very simple. He is exploring options, how to go about this. Okay, and an action, definitely the person is already doing it, right? That's not very complicated, right? Okay. So in this case, you might actually just work with the client's adjustment to the program and accepting the program, because he's not using drugs anymore, right? He's not using drugs. So use that. Where are you at with regards to accepting the program and making the program work? He might still be in pre-contemplation. I'm just here because they just told me. definitely that's pre-contemplation, right? Or he says, yeah, it's helping a little bit, but I'm not sure. Contemplation. Or, I actually begin to participate. Not totally convinced about the program, but I participate in the program. I participate in morning meeting. Yeah. Or you ask them, exploring, what activities do you do? Or what activities of the TC you find helpful for you? Based on that, you can see where he's at with regards to his stages of change in connection with his readiness to actually accept the program or adjust to the program. Okay? So, you're not going to counsel those guys who are already like doing the right thing. He's into the program, right? He's not showing any resistance. He's working with the program. He's using it for himself. Okay? Alright, so you might think about, instead of drug or abstinence, think about adjustment to the program, right? Okay. Alright, let's take a break. It's actually a little bit before 3 o'clock. Be back at 3:30. Okay, 3:30. Thank you. Even though it's not there, we can elicit it, right? That's the nature of motivation. Okay? Okay, so 3 critical components of motivation. First is ready. A matter of priorities. Are you ready? Right? Is the client ready? Is it important for the client? Right? Is it a priority for the client? And willing. Okay? Is it important for the client? Right? So that the client is willing to go through the process. And then, able. He's confident, is capable of changing. So those are the 3 critical components of motivation. Ready, willing, and able. It's like the motto of the army, right? Ready, willing, able. Yeah, right? Those are the 3 components. All right. Going to the basic skills. The basic skills, right? Okay, so this is one of the pillars, right? Of MI. Okay, so this is the actual what we need to do when we are actually doing MI. Okay, ORS. Okay, so what is ORS? Open questions, affirmations, reflective listening, and summaries. Those 4. Okay? Those are the basic skills. Alright. What's the easiest one to do among the 4? Affirmation is the easiest, yes. Right? Very easy. Open questions sometimes, could be challenging. You know why? Because we are so used to asking questions that can be answered yes or no. That's the easiest. Alright? Are you okay? Yes or no. Right? That's right. So it's like sometimes it takes time to ask an open question, right? Okay, so instead of how are you doing? So, right, instead of are you okay? So how about how are you doing? Right? So that's an open question. Which one do you get more? Open or closed? Open, right? You get more. Okay, we'll talk about that in a little bit. Okay, so those are the 4. ORS, open questions, affirmations, reflective listening, and summaries. Alright, motivation interviewing is not a series of techniques for doing therapy, but instead it's a way of being with patients. So in other words, if you have to internalize this. That's what it means. So it's almost like second nature when you're doing counseling. You understand by second nature? There is no effort. There is no thinking. It's just like, a natural response to a particular situation in the counseling session. Okay? All right. Let's look at ORS one at a time. Open questions. Questions that cannot be answered by yes or no. Got it? Okay. How have things been going? That's an example, right? Okay, so why open-ended questions? Because you get more, right? You get more information if you ask open questions. You elicit more. Okay? You elicit more. You get more information from the client. So that's an example. How have things been going? What was that like? What have you noticed about your health? For example, what are your concerns about taking these pills? Now, medication, okay? Not the pills that you abuse. Okay. Interesting. Tell me more. Alright. When would you be most likely to share needles? These are questions about people with HIV or high risk for HIV. How would you like things to be different? Good question. What will you lose or gain if you give up drinking? How did you manage that in the past? What do you want to do next? How can I help you with that? Okay, so open questions, right? You understand? Open questions? Questions that cannot be answered by yes or no. Alright. Be curious and write a story. Tell me more. What is that like? Okay? Those questions. And you elicit more information, right? Hey, what is that like? Or tell me more. Open question. Keep questions clear and short. Clear and short. Avoid negating open questions with close ones. How is it going? And then, have you been taking your medications? You ask an open-ended, and then you ask a close-ended question. Okay? And sometimes it becomes like habit for us. You'll find, when we do the exercises, you'll find yourself doing this. Okay? So just one question, open-ended question. Focus on listening to understand. So you elicit, right, by asking an open question, and then you listen to what the client is saying. Okay? Aha. How about doing this? Okay, let's see how good you are with open questions. Okay, now find a different partner this time. Okay? Alright. Find a different partner. Okay? Alright, so this is the task. Look at this. Pair up with someone. Decide who will speak and who will ask and listen. It's a counselor and a client again, right? Something like that. Okay. Shh. Okay. The listener. Let's say that's the counselor, right? The listener. Begin by asking your partner how she came to this kind of work. Okay? After every few sentences, ask an open question to draw out more of the person's story. Ask only open questions. Alright, every time you ask a closed question, you have to give 1 peso. Alright, okay. Every time you ask a yes or no question, 1 peso. Okay? Okay. So that's the counselor, right? Okay. The client, the speaker. Describe how you came to this work. Okay? Allow pauses after every few sentences to give the listener a chance to practice asking open questions. Clear? The task is clear? Yeah? Alright. So, listen, get another partner, not your old partner. And decide who is going to be the speaker and who is going to be the listener. Alright, let's do it. Come on. Alright, listen. Hello? Shh. Hi! You know, I noticed the psychologists stay with the psychologists. The social workers stay with the social workers. The doctors stay with the... Come on, what's going on here? Huh? Okay, so let's mix it up. Let's mix it up. Come on. Change your partner, please. Okay, get somebody you don't know. Get somebody you don't know. A different job function. Okay, come on. Change. Get someone you don't know. Alright? Get someone different. And you don't know. Different job function. Different profession. I'm going to go around and find out if you're cheating. You're going to give me 20 pesos. Alright. Okay lang. Except. Okay, let's do it. 5 minutes, okay? 5 minutes. Ka partner. Huh? All right, 2 minutes. 2 more minutes. All right, time's up. Time's up. All right, stay there, Louis. Shh. Stay where you're at. Stay where you're at. Okay, how did that go? Stay where you're at now. How did that go? Was that hard? Shh. Okay, so any observation about that? Was that helpful? Did you get more information by asking open questions? You get more elaboration, right? Yes, that's the whole idea, to get more, right? More information. So just think of when you're working with a client, you get more information by asking open questions rather than a yes or no question. Okay? So no issues. It's easy, right? Who made the mistake of asking a closed question? Okay, so that's okay. Yes, that's common. That happens. All right. So in actual counseling, you will catch yourself asking a closed question. The thing though is you ask more open-ended questions. You should be asking more open-ended questions than closed questions. Okay. So if you slip one time, twice, it's okay. It happens. And then later on, once you get used to it, you don't even ask closed questions. It's all open-ended question. Okay? Once you get the hang of it. All right. This time, change role. Change role. Same partner, but change role. Okay. Same group, same partner, but different role. Change role, right? Okay, so I'll give yourself another 5 minutes. All right, let's do it. You already did that? All right, 1 minute. All right, time's up. Time's up. All right. Okay, let's process this. How did that go? How did that exercise go? All right. Did you discover more something new about your colleagues? Yeah? You got more information about them? You get to know them a little better? All right, good, right? Hey, it took 5 minutes to get to know your. It took 5 minutes to get to know your colleague better, right? By just asking open-ended questions, right? Did you who get some like surprising information, something that you did not expect to hear? Anyone about why you ended up working here? Any surprises? Were you surprised to find out the reason? Who has the same reason as your partner for coming to work? Yeah? Okay, so the two of you kind of, yeah, you have the same reason why you ended up working here. You want a paycheck. uh, okay, everybody wants a paycheck. All right, now, besides the paycheck, okay? All right, so who discovered something like, wow, you were impressed by the reason why your coworker decided to come and work? Anyone? Yeah, you were surprised to find out the reason? Oh, cool. That's good. Anyone else? Ikaw din? Na-surprise ka about Dr. Romel? Why he's working here? Na-surprise ka? Alright. Hey, you'll be like, oh, wow. I never expected that, right? Why people will work here. Okay, anything else that, like, it was a surprise? You did not expect it to hear from your partner. Anything? That was a surprise? Who discovered that your partner is your relative? Your missing relative. Yeah. Oh, that can happen, Oh, di ba? Oh, who discovered something like, oh, wow, we have the same thing in common. Right? The same thing in common in life. Or, Yeah, anyone? What? John, what did you say? The same size. Joanne. Okay, the same size. All right, extra large. Oh, XXXX. All right, too many XS large. All right. Okay. No. What else? What? Come on. It seems like everybody really got into it, right? Like, because it's a safe thing, to talk about why you ended up working here. Sometimes, you have reason that was very different, right? And then you ended up working in here and discovered, wow, this is not what I expected, but you kind of stayed anyway. Okay? Who experienced something like that? Like, that was that, yeah? Who, Doc Joey? Right. What? You expected what? What was your expectation when you first came? Yan, tinuro ka na ng partner mo. Who had because I had the same thing. I told you the story, right? How I ended up working in this field. It was very different. I just wanted to be a speaker and, go around schools and do like drug prevention lecture. I ended up like a rehab worker. That was the farthest from my mind. Who experienced something like that? Oh, you didn't expect what the job description was, no?
Actually, I trained in ENT, and then I went to, after the training, nag-work ako sa LGU sa mga district hospital of Isabela, and then now I ended up here.
Alright, so it was a journey for you, Doc. Alright, so for some of us, yeah, we really did not expect that this is where we would land, right? It was a big surprise you landed in the job. But it turns out to be, this is really what you wanted, or you ended up being happy about the job, satisfied about it. But that's the farthest expectation you had in your mind when you first signed up, right? Okay, that's cool. Right, what else? Any other personal discovery that you had? Yes, Doc.
Bali, Doc, I'm an active pediatrician talaga. I'm a pediatrician po. Yun nga lang po, Dr. Romel invited me here. Sabi niya, okay daw po work dito. So, yun po. Ang na-discover ko po. Before po kasi, there's this subspec in our hospital, adolescent medicine. So, that's one of my, dream. But then, it did not materialize. So, siguro, dito ko po yun magagawa. So, hindi ko po alam na meron pala talagang mga adolescent dito. So, parang, kasi na-introduce, na-start ang adolescent dito is 2019. And I got here 2018. So, yun po pala yung magiging role ko po. Yun po.
Alright. Maraming adolescent stuff, No, we have adolescent residents, yes. Okay, so it kind of worked out, Doc, right? It kind of worked, because that's what you wanted to do. It's a different setting, but still it's adolescent. Okay, so it kind of worked out, right? So, that's life, right? Sometimes what you expected doesn't really happen, but it turns out to be okay. Or sometimes it's even better, right? It's even better. All right, so we all have stories of how we ended up actually working in a TRC. I just hope that, all of you really begin to appreciate that, okay, so that was not what I expected, right? But then it turned out to be even better than what you expected. And that's my experience, and I said, oh my God, why are you sending me to this rehab? I have no training. You're lucky you have training like this. I didn't have any training. No books to read. We were just like, put it in there. It's almost like, it's like, you're at the edge of the pool, which is very deep, and you got pushed into it. And you say, swim. It feels like that, you're forced to swim. And I didn't know how to swim. Okay? Alright, so that's how I felt, in the beginning. But later on, once I learned the ropes, it was tough. It was tough negotiating the job. Was not easy, I must tell you, okay? Because I had no idea, I have no expectation. I don't know what to expect. I was just put in that situation, and I tried to make it work. Make it work, okay? And I hope that's your experience also. And after that difficult years of working, I really appreciated that I ended up working the way I work. So I went back to school, right? And then to study psychology because I was burning out. And psychology was just too easy for me because I always look at our work in rehab as psychology in action. Right? It's psychology in action. All the theories and training that you had in college, it's put to action. That's the way I look at it. So to me, going back to graduate school and studying psychology, and I didn't have my psychology in undergrad, it was like a piece of cake, because I know groups, I know one-on-one counseling. I had some ideas about human behavior because of my exposure with clients. So in a way, that was good. I learned a lot of practical things in my work. So I appreciated that. I always am thankful that I ended up doing this. It doesn't pay much at that time. You're better paid than us at that time. Seriously, you're much better paid than us. We were underpaid, but I didn't care about salary at that time. I just loved the work. Okay, So I told you already. If you love your work, you put your heart into it, and you really do a good job with it, somehow you get the compensation one way or another, right? Besides the satisfaction of the job, and then you'll be taken care of. That's just do a good job with what you're doing, and trust that somehow life has a way of balancing things. You understand? Okay, so don't feel like I'm sacrificing. I never felt that way. It was a choice. It was a choice I made. Okay, and I was happy with that choice. Alright, so I hope that's the same experience that you have, guys, for ending up doing this. Okay? Alright, other experiences, discovery about your partner? No? Alright. Oh. Yes. I've been waiting for you to say something,
Good afternoon, family. Ayan, so share ko lang din po yung naging realizations ko with my pair, si Kuya Ray. Happy lang ako na makarinig na may mga kasamahan tayo, syempre including myself, na feeling happy or blessed dahil sa trabahong meron tayo. It is the way how it helps his family. Financially, syempre, yun naman yung pinaka-first. So, kung hindi man lahat, siguro ilan sa atin nararamdaman yung ganun. Affected. Parang ganun. Kasi yung iba sa atin, di ba, karamihan naman kasi talaga, sanay na sa malaking sahod, ganun. So, kanina, habang nag-uusap kami ni Kuya Ray, hindi ako garalgal sa kanya, pero garalgal akong mag-share sa inyo. Kanina nag-share siya, yun yung na-feel ko sa sharing niya. Napaka-bless natin na meron tayong ganitong trabaho with a good salary.
So, and yes, and you know what? Listen, two things that are good so far. I'm sure there are other blessings, right? When I started training actually people at Bikutan before. I would volunteer. If I had free time, I was doing another training, right? If I had free time, I said, okay, I'll volunteer to Bikutan to go there. And during the time, that was under the police. I knew the OIC there. So I said, listen, I'm going to come. And so he would give me time to work with the staff. So I knew what they were going through. Do you know they have to work 2 jobs at that time? Okay? They cannot sustain themselves or their family unless they have 2 jobs because they were not getting paid enough. Okay? So I really felt so bad for them at that time. So the salary was not that great. So how can you actually keep people in the agency? They could not. Every time I go there to train people, half of them were new faces. They, because there is no way to survive. They were just like, what they would do is they would just get some experience from that job and then they're gone. So there is no like long-term desire to actually stay and develop, in that program. That's how it was. So the turnover rate was so high. So how are you gonna develop professional staff, in that way? No way, right? So that was the old system. Okay, and then if you look at the facilities, you will feel so bad with the residents. It was bad. Most of the treatment facilities were not in good shape. Okay, they're in terrible shape. All right, so that's one. Those are the 2 things. Salary was so low, facilities were so bad. Okay, that was the old system. I know, I was going around. Okay, then when DOH actually, and this is pretty recent, right? When the law mandate them to be responsible treatment and rehabilitation, things changed, right? The salary scaling went up. And the most important thing, the facilities got better. All right? The facilities got better. So, in fact, many of the TRC facilities are better than the private programs. Better facilities, okay? You should go around and look at, we have a new building for women in Cebu, right? Beautiful building. Better dormitories. I was there. And I just felt so bad when I look at the dormitories before the new building. And it was like that for years under the NBI because there was no money, not much money provided for the program. But under the DOH, the better budget. Okay, your building got better, your salary got better, so you are many times blessed than those previous professionals who work in the field. Okay, so hey, there's no reason for us not to get better because you don't have to worry about anything. Just make the program better. Your salary is decent, your facility is decent, but make the program better. Right? There's no reason why it should not be. Got it? Okay. Thank you for sharing that. Anything else? Anyone who wants to share? Nobody? All right, listen. Okay, so I'll stop here because you have to be, you're a meeting, right? After this? Okay, so it's 4:30. All right, so Chloe, you want to take over? All right, so guys, I'll see you tomorrow at same time, 8 o'clock. Please be on time. And listen, minimize going out. When you go to the bathroom, just use the bathroom and come back. I think you ended up going somewhere else. That's why you missed the session. There's no reason for you to do that, okay? Don't be like residents. Okay? Your staff, please. And avoid going in and out if you can avoid it. You are not old people that you need the bathroom all the time. You can count the way I go out there. And some of you go out more than I do. Alright? What's that about? Right? There's no reason for you to do that. Unless it's, it's absolutely necessary. But sometimes I think, there's no excuse for that, going out and in and out. I see some people stay here all the time. Okay, so there's no reason for you to do that. Okay, Flo.
Okay, Doc, thank you. Sino yung mga yung mga different teams ng interpret? Sino? Yes, Doc. Kasi kayo yata yung team leader ng mga doctors eh.